Hello, YouTube. Got to get Facebook started here. Yes. Yes. Hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, August 3rd. 30th, and it is time for another IC support group meeting. We do these meetings almost every Sunday, barring craziness like forest fires. Ooh, hold on, I got to turn on my left side. And I have to get out my demo here. So the purpose in my doing these meetings is so strong, so knowledgeable, so incredibly informed that nobody can ever mess with you again. We don't want that to happen. There you go. Is that better? Yeah, that's better. Hello, Crescenda. Hi, Sherry. Hi, Judy. How are you guys doing today? So we're simulcasting live on Facebook and YouTube. If I'm looking up here, I am looking at Facebook. Everything is not even. Hold on. A little late start today. There we go. There we go. Oh, okay. Hello, Sheldon. Hello, Carolyn. It's nice to see you. Hi, Andrea. Thank you so much for the 50 stars on Facebook. I appreciate that very, very much. Hello, Gamal. Nice to see you. So, hello, Shannon. Good to see you too. Hello, Donna. Hi, Elise. Hi, Andrea. Hi, Nancy. Hi, Suzanne. Hi, Barbara. And Barbara says, Jill Osborne, the woman of the galaxy. Not today. I'm a little discombobulated today. I'm a wee bit listen. Okay, you guys, like, I have no shame, right? You know, I'll talk about anything, right? So I'm sitting here getting ready to start my stream like 10 minutes ago. And I realized that my underwear was itchy. I had to get up and change my clothes. I have to be able to stay here for a couple of hours. And you know, those of us who have super sensitive skin, right, man? All it takes is a little bit of something and it makes us crazy. I was going to be crazy if I hadn't done stuff. And now, okay, it's smoky. The colors are changing. We can't go outside. I don't think I can turn my camera so you can't really see how smoky it is out there. It's really, 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 really smoky. And so everything is orange and my face is orange and okay, I'm a mess, but that's okay. We can be messes together. Hello, Debbie. I enjoyed chatting with you on Thursday about my bladder builder order. Was thrilled to actually get you instead of a warehouse employee. People are always surprised when I answer the phone, but yes, believe it or not, I really do answer the phone. I do all the time. Andrea says she does. Thank you, Donna. No, I'm a little wacky today. My hair is real wacky. The smoke is making me crazy. I have a rash right here. I was like, okay, what else can go wrong? All right. So anyway, for anybody new, you probably think I'm a nut, but that's okay. I can be nutty too. Who else is going to dedicate their career talking about the bladder? Yeah, that would be me. All righty then. It's being weird. Hold on, my computer's being very, very weird here. I was just getting ready to buy another one, another streaming computer. Hold on. All right, well, we'll give this a shot. All right, my friends. So listen, let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I am the national IC support group leader. I've been a support group leader for 27 years and counting. This is my 27th year as a support group leader. I am the founder of the IC Network, Interstitial Cystitis or ic-network.com. We are a health education company dedicated to IC and its related pelvic pain conditions. I bring to you 3 college degrees, a degree in chemistry, a degree in pharmacology, drug development, a master's degree in psychology. And my PhD proposal in psychology was, in fact, our website, ic-network.org, which was modeled after a dissertation from Stanford University to bring support to patients who were homebound. Because I, at the time, was homebound because IC pelvic pain struck me when I was 32 years old. And like literally, bam, overnight, my life had changed. I remember driving to work crying. I would like almost scream, hitting a speed bump in the parking lot of my old job. I drank a quart of cranberry juice a year, desperately trying to get better, not understanding that I, in essence, had a bladder injury. And what I was doing was making that bladder injury worse. I've shared my story a couple of times. You know, when I was a kid, I had frequency urgency in 7th grade, 7th, 8th, 9th grade. I went through a whole bunch of urethral dilations. That kind of went away in high school. I became a very competitive, even professional tennis player. And then in my 20s, really weird things started to happen. So like first I got polycystic ovarian syndrome and it started throwing all these ovarian cysts. Then I got irritable bowel, these terrible bend over and screamer cramps. Then I had migraines for about 6 months and tremors. Every now and then, you guys, because I did inherit a little essential tremor that's made worse by working on the computer. So you can tell if I've been working too much because my head will start going like that. And that's just from really, really tight neck muscles. But I didn't have bladder pain, vulvodynia. I had perineal pain every now and then. I didn't have bladder pain until I was in a pool accident. I was training for a triathlon, and the pool that I was training in made a massive mistake with their chemicals one day. And I swam and swallowed massive levels of pool chemicals. And I could tell, I mean, hello, chemistry degree. I could see that there was a problem with the pool water. It was cloudy. It was it wasn't its normal aquamarine blue. It was a little bit kind of slightly greeny blue. But that's how I managed my stress. I was under a lot of stress. I felt good swimming. A whole bunch of us swam. And that night I woke up with what I felt like the world's worst bladder infection. It's terrible. But I had a hunch, you know, so I called the pool the next morning and I went, so guys, is anything weird going on with the pool? And the pool manager goes, why? And I said, well, I swam yesterday. And he immediately interrupted me and he goes, wait, you swam? I went, yeah. He goes, wasn't the close sign up? I went, no. He goes, we bombed the pool yesterday. No one was supposed to swim for 48 hours. And there were about 8 or 9 of us who swam. And in hindsight, if we hadn't been wearing goggles, we probably would have been blinded. And so thus began my journey of very, very intense bladder pain. It felt like the world's worst bladder infection. I went to the doctor the next day. I was diagnosed with chemical cystitis rather than interstitial cystitis. Interstitial cystitis, I wasn't diagnosed with that for about 6 months, didn't know anything about it. And again, like many of you, my doctor told me to go to a psychiatrist, just like, no, wait a second, that doesn't make sense. Come on, this happened after swimming in a pool. Number 2, there really weren't any treatments. And so I did what everybody did. I started drinking cranberry juice. And I drank a quart of cranberry juice a day, not having a clue that, I mean, you know, it's just like, it just shows that no matter how many degrees you have, you sometimes a light bulb doesn't turn on. I was thinking disease process, really. I mean, that's the challenge that we have with interstitial cystitis is a lot of you think that IC is an incurable bladder disease. What you don't understand is for many of us, it is injury, it is trauma. And I sustained a chemical burn in my urinary tract, chemical cystitis, same thing that happens to chemotherapy patients. And then what did I do? I poured a quart of cranberry juice on it every day for a year. So what do you think that acid load did to the wound in my bladder? Much, much worse. By the end of that year, I was barely able to walk. The pain was so intense. Um, I couldn't sleep through the night. I had extreme frequency. I would sleep on my living room floor or on the couch, and I wouldn't flush the toilet at night because I didn't want to wake my family up, right? They had no idea I was peeing every 10 minutes. And thus began this really, really interesting journey of life. Now, some of you may say, hey, well, didn't you sue? And I was like, well, hell, I wanted to sue. I actually sued my employer who fired me while I was out on disability for disability discrimination. I wasn't able to sue the pool because up to that point in time, we had no research studies that showed that pool chemicals can cause injury until last year. Last year, the Center for Disease Control finally issued their pool chemical safety report. And guess what? There's like over 5,000 cases of people who have been harmed by improperly done pool chemicals like I was. So I think in hindsight that, I always say to patients, healing is always happening. You cannot turn off healing. Your healing will not turn off until you have passed on. I think that my bladder probably would have healed fairly quickly if I had not been drinking cranberry juice and soda and coffee and tea and all that sort of stuff. I just didn't understand the concept of bladder injury. But I think what happened over that period of a year is not only did I do massive superficial damage to my bladder wall, which of course, because my bladder's screaming, my pelvic floor is now super, super, super tight because of that, right? I think that the injury became very large. And then also at the same time, I did nerve damage. And I believe that the nerve damage happened not only because of the chemicals, but because I kept pouring acid on the wound that was irritating the nerves, causing the nerves to release substance P, and then mast cells release histamine. And there's this whole biological process that happens with superficial bladder injury. And, thus began this very, very interesting journey. I will say that in my case, there were kind of two pivotal moments for me. And that was back in early 1993, when I found the Interstitial Cystitis Association, which is the other national group. And I talked with my nearest support group leader, and she goes, do you know about the diet? And I was like, no, what's a diet? He goes, well, you have to avoid things that are high in acid, like cranberry juice. I was like, what? Wait, what? I've been drinking a quart of cranberry juice a day. It's like, yeah, no. And so she was the first to really give me good practical information on how to not irritate the wound, for lack of a better term, and how to kind of tend the, even though we didn't talk about it as a wound back then, but kind of how to support healing in the bladder. And then, the other thing that she really did for me that was very, very, I'm remarkably grateful, even though I now run the competing organization to the ICA, obviously the IC network. That one contact changed my life, and it set me on a better path. And so I remember I was talking with her and I was crying about the pain. And you go through this whole thing of why me and all this sort of stuff, and you think it's incurable, and you think you're lost and that nobody will love you, and this horrible, horrible, negative thoughts that happen when you don't know what's wrong with you and you're scared. I mean, that's fairly normal. So anyway, I was just kind of bemoaning my fate to her and crying to her. It's like, I'm supposed to get my doctorate, yada, 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 and it's like all lost. And I told her, I said, what I do is I force myself to go walk or run around the block because that makes me feel good. Endorphins made me feel good. until I was done. And then I got that much worse. And I kind of got to the point where it's like, I mean, I just get it. I just do it. I force myself to do it. And she said, Jill, if you had a broken leg, would you go run a marathon on a broken leg? And I'm like, no. He goes, well, you do realize you kind of have a broken bladder right now, right? And so maybe going and running isn't the right thing for you to do right now. Maybe this is about giving your body a little bit of time to calm down and heal. And nobody had ever said that to me before. Nobody had ever said, hey, you know what? I mean, we know that the human body heals when we're sleeping and at rest. And I was just so over the top freaked out about the whole thing that I was just determined to just do my normal life, even though it was hurting me. And I remember I was talking to my parents afterwards, and they went, Jill, you couldn't see it, but we could see it. Every time you went and worked out, you hurt yourself. You were in so much worse pain. And of course, now we understand the role of the pelvic floor muscles. And what was I doing? I was traumatizing my pelvic floor muscles, which were already super, super tight. And I was just reinforcing the whole thing. So for those of you who are new, I talk about number one, the 5 subtypes of IC. Not everybody's the same. Not everybody's the same. For some of you, IC begins when you're a kid. For others, IC begins when you're after menopause, after menopause strikes. For some of you, IC begins after having a baby. For others, IC begins after chemotherapy. You're all diagnosed with IC, but are you freaking the same? No, you're not. You're not the same. And we know that because a one treatment fits all approach simply does not work. If this were a bladder disease, Elmeron would work for everybody. And it doesn't. Elmeron barely performs slightly above placebo. Like 25%, 30%. So what researchers have been doing now for the last 10 years or so is they're trying to define the subtypes, the variants. We need to know what these are so that we can give you the right treatment for your specific variation. Because think about me. I had a chemical injury on my bladder, right? I see subtype 2 bladder wall driven. So we have 5 subtypes. Subtype 1, Hunter's lesion. Subtype 2, bladder wall driven. Subtype 3, pelvic floor driven. Subtype 4 is nerve driven, and subtype 5 is central sensitization. So in my case, antibiotics would have done nothing because I didn't have an infection. What might have helped a little bit was maybe a bladder coating, but as long as I was drinking acid every day, bladder coating wouldn't have worked. I mean, like seriously, if you were taking Elmeron for 20 years and you were drinking coffee every day, the Elmeron never had a chance to help because the coffee just washed it out. Anything strongly acidic would have washed it out. Hello, Judy. Judy, first time here. My 17-year-old daughter was diagnosed this summer. So happy to come across this Facebook Live. It's been a long road. Judy, I really want to help. I absolutely want to help. So, Judy, for you especially, it's very, very important that you understand that IC has many variants. We are not the same. We no longer think of IC as an incurable bladder disease. Why? Because for many of us, there's another pelvic structure involved. If you have fibroid tumors pushing on your bladder, that could be the cause of your symptoms. If you've got endometriosis on top of your bladder, that could be the issue. If you've fallen and broken your tailbone and your tailbone is crooked, that could be the cause of your symptoms. If you have a Tarlov cyst, that could be the cause of your symptoms. If you don't walk normally, that could be the problem with your symptoms. And so what we're doing now is variants. We're trying to understand unique variants. And so it would be very important for you to take a step back and ask yourself, what was happening in your daughter's daily life that right before this began? Was she a dancer? Was she a gymnast? Was she a cheerleader? Was she a bike rider? Did she fall? Was there any sort of trauma? So, hey, people are asking, are the fires under control? The fires are still raging. They're just going towards the ocean rather than towards us. We cannot go outside. It is cloudy outside for sure, 100%. Smoky outside. It stinks. Welcome to fire season. This is going to be like this for the next 3 to 4 months for us. Anybody who wants to move to California, don't. We all want to leave. You know, unless you're going to live in the middle of San Francisco, anywhere else you live, you're at risk of these firestorms now. So anyway, so there you go. Kathy Riken says, does watermelon make you flare? Not for some people it does, for others it doesn't. For some people it does, but for others it doesn't. Eric says, I'm really suffering right now. Eric, tell us about your pain. What's going on with your pain? Kat says, is DMSO bad for bladder installations? Well, again, it begins with your subtype. Listen, we cannot have a good discussion about the right therapies for you until we understand your unique anatomy. So let's talk about subtype 1, Hunner's lesions. If you've got Hunner's lesions, which are big, red, bloody spots on your bladder wall, DMSO would be a waste of time. Lesions only respond to lesion-specific therapy, usually a steroid injection or cauterization or hyperbaric oxygen therapy or Lyris. And remember that lesions have now been connected to viral infections for many patients. If you are IC subtype 2 bladder wall driven, we got three variants, and potentially even 4 variants in this category. We've got number 1, a chemical injury. Number 2, estrogen atrophy. Number 3, chronic infection, chronic fungal infection, maybe chronic bacterial infection. And number 4, maybe some hormone imbalance, maybe some other hormone issues going on. So DMSO was the first medication approved for bladder installations back in the 1960s. They thought it would be a miracle drug. I interviewed the guy who actually who invented it. They were looking for a way to transport kidneys scheduled for transplant from one hospital to another. And if you transplanted those in water or ice, the kidneys were damaged. They were looking for something that wouldn't damage the kidneys. It turned out to be DMSO, which is a byproduct of the paper industry. They thought at that time it would be the miracle cure for a whole bunch of different problems. It failed every single clinical study except the IC study, and barely passed the IC one, but it did get FDA approved for IC. It acts as a penetrant. It's pretty good at getting through the bladder wall, where it causes a lot of different issues, a lot of different effects, mast cell reduction, things like that. But if you use it at the FDA approved dose of 50%, we have research studies that show that it can cause irreversible bladder spasms. So DMSO has definitely been kind of falling out of favor for the last 10 years because we have other bladder therapies that are more calming and soothing, specifically rescue installations, a heparin lidocaine installation or an Elmeron lidocaine installation. They call them rescues for a reason. They rescue you out of a flare. You walk out of that clinic usually pain-free after a rescue. That is, if you are IC subtype 2 bladder wall driven. But what if you're IC subtype 3 pelvic floor driven? What if your symptoms began after a muscle injury, after a fall, after a long motorcycle ride, after having a baby, after having a surgery, where your dominant issue are muscles so tight they're restricting blood flow to the bladder? So our therapeutic priority for this patient, like, you have no freaking clue that you have a bladder injury. None at all. You have no clue you have a bladder injury, or I'm sorry, a muscle injury, until one day you have frequency urgency and you call the doctor and go, hey, I think I have a bladder infection. The doctor goes, okay, let's test your urine, give you an antibiotic. Your urine comes back clear, but they give you the antibiotic anyway. And you might be thinking you have infection over and over and over again. Then finally, one day, the doctor goes, hey, I think you might have overactive bladder. They give you a Detrol or ditropan. They don't work. Go back to the doctor. I hate to have interstitial cystitis. Let's try interstitial cystitis meds. And they might help a little bit with symptoms, but guess what? It's not going to fix it, because a bladder therapy does not deal with the fundamental problem of somebody who has a pelvic floor injury, and that is poor blood flow. When you fall, bam, you suffer a compression injury. Okay, if you fall on your tailbone, in addition to potentially breaking your tailbone, you are falling on your glute. You immediately compress the muscle. Bam, like that. So what happens? when that muscle that's compressed. Muscle fibers are damaged, blood vessels are damaged because that's what causes bruising, and nerves are damaged. And what happens anywhere you have these injuries is you usually get trigger points, and trigger points are like long-term injuries. It's impossible for the muscle to be healthy if it has trigger points. And then slowly over time, we get a lot of nerve inflammation. And then the nerves talk to the other nerves, and the other nerves start becoming inflamed. And eventually, the nerves in the bladder wall themselves also become inflamed and damaged from that muscle injury. We call that a somatovisceral reflex. There are two reflexes in the pelvis, viscerosomatic, and that is, can organs change muscles? And the answer is yes. If your bladder's hurting, your pelvic floor will get tight every single time. You cannot turn that off. That is entirely subconscious. The real question is, can muscles change the behavior of an organ? And the answer is, oh, hell yeah, definitely. That if your muscles are tight and injured and dysfunctional, they're going to restrict blood flow to the bladder. It's going to be very hard for the bladder and the vulva and other organs to be functionally healthy because they aren't getting good oxygenation. They're not getting good nutrition. You're going to see tissue breakdown. You're going to see more pain, more discomfort. So our therapeutic priority for this group of patients is not to treat the bladder wall. It's to treat the pelvic floor. Our goal is to restore blood flow. To restore blood flow. Once we restore blood flow by getting these muscles nice and released and relaxed and healthy, that's when we start seeing cures. We can use the word cure now. And it was Dr. Christopher Payne, when he proposed his 5 subtypes for IC about 5 years ago, the system that I use, he said, that's the injustice of how IC patients are treated today, is you're all told that it's an incurable bladder disease. But for many of you, there's no disease process. If you've got estrogen atrophy, if your symptoms began after menopause or perimenopause or a hysterectomy, you have estrogen atrophy. That's not a disease. That's just your skin not getting enough estrogen to be healthy. How do we treat that? We treat that with a little bit of estrogen. So anyway, so Carolyn says, I drink cranberry juice every day. Carolyn, you shouldn't. You should not be drinking cranberry juice every day. It is the acid bomb. If you're doing cranberry juice because you think that it is going to help prevent a UTI, you need to switch to a PAC product, a proanthocyanidin product, which has the beneficial ingredient of cranberry without the acid load of the cranberry. Cranberry is very, very acidic. Take it from somebody who was in pain for 5 years after drinking a quart of cranberry juice every day for a year. And what I would suggest is this: prevent. For anybody out there where you're really worried about getting recurring infections and you have a record of recurring infections, then prevent would be something that would be quite helpful, because it contains proanthocyanidins, which research studies have been found to be the most helpful at preventing infection, preventing E. coli infection. And you can get this right from the IC Network stop, Prevent. It's similar to Allura, but it's half the price. Kara says, the pool chemical thing is blowing my mind. I used to swim every week when I was growing up. You know, what's interesting is I think I've worked now with probably about 40 or 50 patients in the last 20 years who also had a pool injury, one of whom was a swim coach at the University of California. And the same thing that happened to me happened to her. It was very, very interesting. Judy says, the pool chemicals can cause it. Can essential oils or bath bombs in the bath do the same? Yeah, I do believe that they can. Yes, I certainly would never use a bath bomb. Hey man, listen, you know, redhead Norway, super sensitive skin. We didn't even use bubble bath when I was a kid because bubble bath irritated my skin. And it's just true for all the women in my family. There's no way in heck I would ever use any bath bomb, any bath oil, anything at all like that, because those are notorious for irritating the vulva, irritating the skin, irritating the urethra. I would absolutely not do that. Jessica Shisti only takes baths with Epsom salts. You can do Aveeno oatmeal, colloidal oatmeal, if you don't mind the mess it makes in the bathtub afterwards. That's very soothing. I like putting baking soda in the bath. I might take one bath a year, and that's only if I'm really, really hurting. Judy says, are baths okay if you skip the soap? Sometimes a sitz bath. Yeah, yeah, sure. I mean, sure. Um, I, when I was younger, uh, how do I want to say this? Let's see. My refuge was the bathtub. There's like nothing better on a cold winter afternoon after school, when nobody else is home, and and you had a long day and you're sore and whatever, just go in and take a bath. And I always just put baking soda in the bath water. But you have to be careful of bathtubs that have jets in them, because if the jets are installed incorrectly, any jets are supposed to be at a downward angle. If they're horizontal or they're slightly upwards, bath water can collect in the jet, and they become really powerful bacteria factories. And so if you have a jet bathtub, you got to be a little bit extra careful with the jet bathtubs. Joan says, I believe I have 4 of the 5 subtypes with no Hunner's lesions. Well, so your job here is to try to figure out what is primary and what is secondary. I call it the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. And that's why it's really, really, really helpful to go back into your history and think about what events might have triggered this. When did your IC symptoms begin? Did they begin after hysterectomy, or did they begin, after you were raped, or did they begin after you had a baby, or did they begin while you were traveling? We have to try to understand context here. Because if you had, let's say your IC began after really messed up muscles, and those muscles have never been addressed. And for some of you have muscles rock hard, just like as hard as a rock. They are so messed up. And there's just no way that anything in your pelvis is going to be normal when you've got tight muscles. And yeah, at that point in time, especially if it's prolonged, you're going to have nerve issues. Sure, you're going to have muscle issues. You're going to have blood flow issues. And you're probably going to have vulvodynia and or bladder issues too, all from the underlying muscle injury. Now, hold on here. Somebody just down here on YouTube. Donna says, is the IC network warehouse open? The answer is yes. Yes, it is. Suzanne says, who do we see when the urologist doesn't even know what's going on? You get a second opinion from a more informed urologist, or a pelvic pain specialist, or a urogynecologist. Amber, hello, I'm new here. I've had 6 hydrodistensions every 3 months, now scheduled for InterStim in October. Girl, I'm 32. You're peeing 30 times a day. I don't want to, girl. I hope you will join. We're going to switch over into Zoom in about 45 minutes. I'd love for you to hear your story, but we don't do no, it's really rare that hydrodistensions would be done every 3 months. Why are they doing that? Especially at your age. Can you tell us a little bit about your case and when your symptoms started? And have you watched our subtyping video? Do you have any clue what subtype you might be? Nancy says, should you not go into a pool then if you have IC? No, that's not true. Pools are great pelvic floor friendly exercise. You just got to make sure that the pool is properly cared for. That's all. All right, let's go back to Facebook here. Vaughn says, can ICE be caused by traumatic birth? All the time. We see it all the time. I was working with a patient yesterday, as a matter of fact, who had 3 babies. Her first baby, she had a massive muscle tear. And then her third baby, she also had a pretty significant tear. And so what does that do? If you have a difficult birth, what you're looking at is pelvic floor injury. So your muscles have been traumatized. They may have been cut. You may have scar tissue. You may have trigger points. And that is all going to influence blood flow, circulation, and nerve function to your bladder and to your pelvis. And so, Vaughn, absolutely, we see it all the time. Carolyn says she's got fibroids, right? So if you have fibroids pushing on your bladder, that would potentially be the issue. Eric says, how do you ever figure out what's really going on? Well, it takes a lot of work and persistence. And, man, we as IC patients, you just don't give up. You got to be your own advocate. But it begins with you. It begins with your knowledge level. It begins with your ability to really talk about your symptoms. When you go to a new doctor, what do I always say? Number one, you never, ever, ever tell them you have interstitial cystitis. We don't want you to fall down the rabbit hole of their belief. You got to walk in fully prepared to discuss your symptoms in depth. Where is your pain located? Is it on the outside of your body? Is it on the inside of your body? Is it to the left? Is it to the right? What makes it worse? What makes it better? What does it feel like? Does it feel like razor blades, ground glass? Do you have any weird symptoms? Do you have a vibration? When you sit down, do you have pain shooting down your legs or up your back? All of those are important symptoms, because if you have any of those symptoms, we're going to go right to your pelvic floor. Now, Amber has shared what happened to her. She says, I've always had microscopic blood in my urine since I was 2. Interesting. You've always had pelvic pain. And that when you were 16, it was much worse because you were a victim. Your doctors have done every surgery. My doctor insists on the hydro. So, Amber, what does your bladder look like? She says, I got my diagnosis a year ago. Doctors told me it was all in my head. My mouth dropped seeing my symptoms or the definition. So Amber, give us a clue. Tell us, do you have pictures of your bladder? What does your bladder look like? Let me show you a couple pictures. Hold on. Okay, so these are pictures of Hunner's lesions, IC subtype 1, right? So they're characterized by having a very dark red center, and then they have arms of redness that extend through, away from that red area. So this is a classic Hunner's lesion. There is a movement now, and it's happening. It's absolutely happening now. The new guidelines that were just released in Europe and also in Asia have now split Hunner's lesions patients away from everybody else, because this is the true disease process. We now believe, we have research that shows that these patients may have a virus in their urine. They may have a viral infection in their bladder. So that would explain why they never responded to Elmeron. So that's one of the core kind of theories of that, is that that when we biopsy this tissue, there's massive inflammation. There's a war happening. Anytime you've got inflammation, that's a biological war. That means your body is fighting something. And now we have a clue as to what it's fighting, because we have research from Europe, and now we have a brand new study from our own National Institutes of Health, which has found the polyoma BK and the polyoma JC virus in a small group of patients. And we now, when you think bladder infection, you're thinking bacteria. That's a mistake. You have to think about viruses and a lot of fungus too. Okay, so that's That's what a Hunner's lesion looks. These are what Hunner's lesions look like, Amber. When they're doing their hydrodistension, are they cauterizing anything? Just out of curiosity. She showed you pictures of the first time, but never gave it to me. She said my bladder looks angry. It'd be really cool for you to get pictures of it. So let's look at this one. Let's look at this picture. Now this is the rest of IC patients who have kind of bladder wall issues. This is what your bladder looks like, right? Very different. Oops, hold on. They don't look the same, do they? They don't look the same. These are called petechial hemorrhages or glomulations. And this happens, we now believe that these happen because of the test, that when you stretch the bladder, you cause little hemorrhages. So I just took the classes for this year's American Urology Association meeting. And I took the big IC class that was taught by Dr. Phil Hanno. And here, hold on, let me get my notes here. Where did I put them? I wrote a really big article on this in our magazine, which should be done this week. But let me get it. Highlights from the course on IC. Look, you can even see all my fixes. Okay, so this is a little bit interesting piece of history. I think that's really would be really beneficial for you to know. So let's go back in time 100 years. Actually, let's go back in time 150 years, 170 years. It was doctors in Europe who first wrote a case study of women with frequency urgency. And if you go back to that English journal and you read what that doctor wrote, it's perfect for today. Frequency urgency of an unexplained origin at that time. I mean, that doctor nailed it. But they didn't have the ability to look in the bladder until the 1920s. And that was when the cystoscope was invented. So that's when they could actually create a small enough device that they could put through the urethra and actually look at the bladder wall. And that's when Dr. Guy Hunner was the first to look into a bladder of patients. And in some of them, he saw these. So he called them, that's why they're called Hunner's ulcers or Hunner's lesions, named after him. But not in every patient, but in some patients, he saw Hunner's lesions. Then around I have the exact date in my article. Hold on. 1949, they had better equipment. And they could see more of the bladder. And they also had a new way of looking at the bladder called a hydrodistension. And that is when a Dr. Philip Hand, saw these petechial hemorrhaging. It's like, oh, okay, maybe this is IC. You think this is IC? Well, he thought this was IC. And so for up until 1987? No, 1978, this was considered IC, right? And then in 1978, two of the biggest urologists in the world, Doctors Messing and Stamey out of Stanford, basically proposed a new definition for IC, which said you had to have these in addition to frequency urgency, or this to be diagnosed with IC. Like, okay, and the whole world followed that plan. And as Dr. Hanno said in his AUA class, that for 30 years sent us down in the wrong direction. That was a mistake. It was a huge mistake. Then in 11 years later, in 1987, the National Institutes of Health created their first diagnostic criteria for IC for research studies. And they did the same thing. They said, if you had these and frequency urgency, you would be diagnosed with IC. So all the research studies looked for these. But then a very smart doctor went, wait a second. Let's see if this happens to normal women with no bladder symptoms. So they took 50 women scheduled for tubal ligation and asked, hey man, can we look at your bladder with a hydrodistension? Then they signed up for the research study. What do you think happened? Women with no symptoms at all. And men, you're involved too, but I'm just giving you the specific. I mean, this happens to guys too all the time. We knew that from World War II. Okay, but anyway, isn't it interesting that a woman with no bladder symptoms has a bladder that looks like this when you distend it? Doesn't that mean that maybe the test itself is flawed? The answer is yes. So then in 2011, the American Urology Association released their guidelines for IC. And guess what? They abandoned. They said, no, we're not going to use really either one of these. We're just going to focus on your symptoms. And that also was a mistake. And so where are we back in 2020? Where are we right now? We've gone back 100 years in the right direction. So this is what we're doing now. Hunner's lesions represent its own unique disease. And you will see in the future, this is going to be split off from IC so that you all get your own research and your own support and your own therapies. And that is a very, very good thing because there's a huge difference between this and this. Only 10% of IC patients have this right now. The rest of you have this, or the rest of you have an entirely normal bladder. And that's because for the rest of you, you might not even have a bladder issue. You might have a pelvic floor issue or a fibroid tumor or something like that. But when you think about incurable bladder disease, this is not incurable bladder disease potentially. This could be a virus, which is going to require antiviral therapy and more aggressive therapy. So anyway, there's a little bit of history for you. It's very, very interesting. And so Dr. Hanno started his IC class with exactly those points, that for 30 years we went down the wrong pathway, and that now, he goes, we've gone in a big circle in our understanding of IC. In 1915, Hunner's lesions defined IC. In 1978, glomerations were thought to define IC. In 2011, the AUA threw out cystoscopy findings entirely, but researchers now agree that glomerations have little significance. We don't care about glomerations anymore. They don't mean anything. They have not been linked in any positive way with new therapies, better diagnostic workups, anything like that. So for those of you who had petechial hemorrhaging for glomerations, just know that that's thrown out now. We're not going to use those anymore. Sorry, man, you know what, guys? I love the arcane trivia here, so bear with me when I go down that rabbit hole. Donna says, broke my tailbone when I was 25, but I've been having IC pain since I was the age of 11. My symptoms did not become worse after the tail break. Should I look into this tail break anyway? Yes, you should. You should. You know, there's a very, very important book that everyone should get, especially, was it Amber? No, it was Donna. But Amber, you too. Amber, I'm going to come back to you for a moment. I will come back to you in a minute. Breaking Through Chronic Pelvic Pain is the book of books. In my opinion, it is the best book that has ever been written. And it is the book which dives deeply into how muscles and nerves cause bladder problems. And he introduces a very, very important concept here. You know, there are some of you, so I wish I could do raise hands. Raise your hand if sex is painful. Raise your hand if you dreaded going to the OBGYN because you knew that putting that speculum in would hurt. Some of you have had vaginismus or tight pelvic floor muscles your entire life. And the question is why? Why would you have tight pelvic floor muscles? Well, number one, it could be the result of trauma. You falling on your tailbone when you were a kid badly. It's possible. It could also relate to if you were a bedwetter and your parents beat you, and thus you started tightening your pelvic floor muscles, desperately trying not to pee. That's absolutely real. Sexual abuse, absolutely real. But here's the kicker. Dr. Weiss in this book introduces the concept of a mechanical injury. And that is there something wrong elsewhere that keeps putting pressure and tension on your pelvic floor? Like, is there one leg longer than the other? Is there a hip that isn't quite normal? Are you pigeon-toed or duck-footed? Do you have are your arches flat? And ultimately, in the end, what he found in his pelvic pain clinic for patients who continue to have extremely tight muscles over and over and over, I mean, that's really what baffled him. He was a master at getting rid of trigger points, a master. What puzzled him is, why are you back 2 weeks later with the same trigger point? I got rid of that 2 weeks ago. Why is it back? Why is this muscle always tight? Why is it always Jill's left piriformis muscle? Why? Why that muscle? And the answer is, for many of you, there's a bony abnormality. Like for me, it's my SI joint, which has been screaming the last 3 days. I can't do I'm supposed to do prolotherapy for my SI joint, but we haven't been able to do it because of COVID. So I have a joint that is moving when it's not supposed to be moving, and my piriformis muscle is compensating, getting very, very tight, right? So for some kids, sometimes it's related to a problem with their feet or their knees or scoliosis or something like that that causes long-term chronic pelvic floor muscle tension. So let's go back to Amber for a moment here. So Amber is on YouTube. She says, I have bad urgency when you're doing your diary. 50, you have to urinate when you have 50 mLs, 100 mLs. It makes you feel like you're not going to make it. Amber, when you run to the bathroom, are you running to reduce pain, or are you running because you think you're going to be incontinent? Those are two very different types of urgency. Are you running to the bathroom to reduce pain, or are you running to the bathroom because you think you're going to leak? Eric says, I do believe I have central sensitization. That's IC subtype 5. In some cases, sensitive skin can be inherited, and we're talking systemic neurosensitivity. We tend to have very, very sensitive skin, drug sensitive, food sensitive, chemically sensitive. We have a wicked sense of smell, absolutely inherited in my family. Goes back every generation, which is why, getting back to an early conversation, we never used bubble bath when I was a kid, because reacted to it every single time. But sometimes central sensitization happens to an injury. Okay, Amber says, I just feel. Amber, but think about it. What's motivating you to go to the bathroom? I have to go really bad. My eyes tear up with urgency. And you're straining. Okay, Amber. Have you had, so Amber's 32 years old. She's participating via YouTube. She's been diagnosed for I don't remember how long. Hold on a sec. She got her diagnosis a year ago. She's always had microscopic blood in her urine. She's always had pelvic pain. Okay, so Amber, have you, okay, here's an important question. When you try to pee, can you pee right away, or do you sit there 5, 10, 15, 20, 30 seconds before you can let urine out? So do you have to strain to pee every single time, hun? Okay, girl, have you had a pelvic floor assessment? So she said, yeah, for her to pee, she's having to push urine out. She cannot pee naturally. So Amber, have you had a pelvic floor assessment? Do we know what is going on with your muscles, my dear? Okay, and what did they say? Because listen, urination is about relaxation. You basically sit on the toilet or you're standing there if you're a guy. A muscle, your pelvic floor, your levator area muscles relax almost instantaneously. Your sphincter opens and bam, you pee within a second. That's normal muscle function. If you're sitting there hesitating and you cannot start your urine stream, that's usually a sign of very, very tight muscles, your levator ani muscles. And let me bring out my new handy dandy. I love my new demo here. So look, it's a pelvis. And hold on. Understand historically, you guys, it's not like I'm making this up, right? I'm not making this up. There's a long history. If you go back 100 years and you start looking at the articles written about IC, many of them talk about muscles so tight they resemble tight piano strings, right? So we have known, doctors have known for decades that muscles were tight. The challenge is that urologists just stay in their box. They stay in the urinary tract. They didn't consider the consequences of those tight muscles. And it wasn't until a physical therapist named Rhonda Cotterinos in the 2000s who started going to urology clinics and started showing, hey guys, look, pelvic floor physical therapy actually helps some patients. Here, hold on a sec. Do you want to come say hi? Do you want to come say hi?
Oh, who is it?
It is about 75 people watching me right now.
Oh my goodness.
Come here, you guys. Here, you guys, you come meet the mother of the IC network. She's 91 years old. Come here, Mom.
Oh, that's the picture is lovely.
Okay, you have to bend down just a little bit. Here. There she is. Helen Osborne, my friends. Helen Osborne. I would not be here today if this woman 27 years ago hadn't drove me in the car in the back seat from Lake Tahoe as I was driving with IC pain, and you had stopped driving freeways, but we rented a car and you drove me home so I could go to the hospital. You remember that?
Yeah.
Yeah.
It was a long drive.
Let me tell you, having moms and dads who will care for you I would not be here I'm just being real truthful here. I would not be here today if I hadn't had my mom and dad helping me. There's no doubt about it. No doubt about it. So she came with me to all the IC conferences. We've been to Europe on IC events. We've been to Washington, DC, San Antonio, Florida. She's come to the IC classes. And so she was my partner in crime for many, many years until, unfortunately, a hip replacement went bad. And so, anyway. Okay, are you done?
I guess.
You want to just say hi? Just say hi, everybody.
She's a super daughter taking care of her elderly grandparents now.
Yeah, parents, yeah. All right. Okay, see you later.
Okay.
Get your walker. You shouldn't be using, get your walker. Yikes. Hold on. Okay, so you get through. All right, see you on the other side. All right. Of course I'm going to take care of her. Listen, I couldn't function for 5 years, guys. I mean, literally, I lost my job, lost my health insurance, lived on credit cards, and just begged for somebody to solve my problem. And if my parents hadn't been able to drive me to the doctor, because I could not drive myself to the doctor, it was amazing. All right, so we're getting back to, let's go back here for a moment. So Amber, I want to explain something to you. So look, here's your pelvic cavity from the top down. And inside your pelvic cavity, you have muscles in 3 layers. So the deepest muscles are going to be the muscles on the side. These are your piriformis muscle is the classic one. And I think the obturator is the other one. And then you have a layer of middle muscles down here. And you're going to notice, look, there's a hole in the muscle. Actually, there are 3 holes in the pelvic floor muscles of women, because the pelvic floor muscles are the only group in the human body that also control major bodily functions. Because there's a hole in there, there's a hole in there that lets urine out. There's a hole in there for your vagina that will let babies out, or, wet inside. And there's a hole in there for your rectum, right? And so if those pelvic floor muscles are messed up, guess what? You're not going to be able to pee easily. If those muscles are tight, it's going to be hard for you to pee. And if we look at this, this is, let me put on the pelvic floor here. Put on the levator muscles. So now we're looking at the pelvic floor from the bottom. And these are the shallow muscles. These are the levator muscles, right? So they go out in a triangle, and look, you can see the urethra, you can see the vagina, and look, you can see the rectum. And the levator ani continues to go all the way down past the rectum. So these are the muscles that, if these muscles are tight, you're not going to be able to pee normally. And the problem is that when you strain and push, you're actually reinforcing tension, which is going to make it even harder for you to pee over time. All right, so Amber says here, so we're talking about Amber here for a moment. She's on YouTube. They put her on typical bladder med. She cannot urinate normally. She has to push and strain every single time. All right, now, so Amber, she finally, now we know what's going on here. She says that she has a prolapse. You have a prolapse. And I bet, have you had babies? You probably got a prolapse from babies, or you could have gotten a prolapse from straining. So when you get a prolapse, basically what happens is that these muscles, gosh, how do we demonstrate a prolapse? They get so weakened that whatever's above them start to fall out. So you can have a vaginal prolapse where your vagina starts to protrude through here. You can have a bladder prolapse. You could have a rectocele. You could have a cystocele. There are all sorts of things like that. Yeah, girl, that's why your muscles are messed up, is you've got a prolapse. The question is how did that happen? Do we have any idea? Okay, you have a 6-year-old and a 3-year-old. Did this all start after you had your children? Did you have some sort of traumatic injury with your first baby or your second baby? Sometimes what happens too, so here. Oh, look, I actually have a bladder to demonstrate now. I didn't have that before. Okay, so look. So here is your pelvic floor, and here's your bladder. So what happens when your pelvic floor gets weakened and loose? And obviously this is, not quite anatomically correct, but what happens is you can see that things start to fall out of position. And for some women, they feel it. You feel something hard coming out of your vagina. And InterStim would not fix a prolapse. InterStim will not touch a prolapse. If you have a bladder that's out of position, it's really about trying to fix that first. We've got to get those muscles healthy. So have you worked at all with anybody on your muscles, hun? Man, you're checking muscle boxes right and left here. Having to strain to pee? That's so, but okay. So I see there, she says no, she's never worked with a pelvic floor physical therapist. That is a tragedy. Because if you were at any top tier IC clinic, at the very first appointment, they would test your pelvic floor. And if your pelvic floor is tight or dysfunctional, they will send you to physical therapy. And they certainly are not going to do any sort of aggressive, invasive therapy until your muscles are properly worked on. There are 6 steps of treatment. Oh, wait. Okay. Okay. So hold on a sec. So I was making a point here. Let me finish the other point I was making, and that is that so we knew 100 years ago doctors were describing muscles that were really tight. There's no doubt about it. I mean, you can read them. You can read those early papers. And again, it wasn't until like 1990s, 2000 that physical therapist Rhonda Cotterinos became our champion and started going to these conferences and talking to urologists and saying, hey, what about the tight muscles? If you work on the muscles, guess what? Sometimes patients get better. And they basically passive aggressively ignored her for a couple of years. But then she was able to convince the National Institutes of Health to do a research study on it. And they did a multi-center study testing the effectiveness of pelvic floor physical therapy in treating the symptoms of IC. And the results for that were released in 2008, 12 years ago. And what do you think? That study, and Dr. Hanno talks about it in this paper, the only meaningful study that was produced by the IC Clinical Research Network was a study that proved that pelvic floor physical therapy was remarkably successful at reducing the symptoms of IC. Stunningly successful, more successful than bladder therapies in many, many patients. And when that study came out in 2008, the IC world turned on its head. Because guess what? Up to that point, everybody was going bladder, 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 bladder. But wait a second. If it were a bladder problem, why would physical therapy help? Why would physical therapy sometimes cure patients? Maybe for some of you, it wasn't your bladder ever. Maybe for some of you, it was injuries down here with these muscles instead. Look at, for example, one of the things we consistently see are tailbone injuries. It's astonishing the number of you who have tailbone injuries. So let's take off the levators and let's look at the tailbone here, right? Okay, so let's look at the tailbone and look at the muscles that attach to the tailbone, right? So we've got these muscles that attach to the tailbone. We got these, right? If your tailbone is bent out of shape, it's going to put pressure on one side. You're going to overstretch one side. If it's crooked, and for some of you, instead of being arced under, it's arced this way. We had one very important IC patient. I told her story in our in my magazine last year. Dropped my elevators. She attended one of my meetings, and I always say, listen, you are an anatomical mystery to be solved. We have to understand your anatomy first. And so she attended one of these, she looked at the subtypes, and she thought she had pudendal neuralgia. She thought she was IC subtype 4 pudendal neuralgia because she was having nerve-driven pain. So she goes to her doctor and shows the doctor the info on pudendal nerve entrapment. And the doctor goes, yeah, you know what? I kind of think you do. And so then she thinks she went to another doctor who did an X-ray or CAT scan or something. And what they found was that her tailbone was opposite of the way. Instead of being like this, it was like this. Her tailbone was badly distorted. And so what she did something that I have a little trouble accepting. The orthopedic surgeon wasn't prepared to fix it. So she went to a chiropractor, and she did chiropractor every week for a year. And guess what? It completely put her tailbone back in the correct position. And guess what? she went from being severely disabled to having a baby and having a normal life once they got her tailbone in the correct position. So that shows you. Amber says, I'll talk to my family doctor about it. She told me if I find anyone else or something to help, she will give a referral. Amber, what state do you live in? What state do you live in? So let's just talk for a moment about, so Amber's doctor now realized they haven't even done the proper muscle work yet. Virginia. Okay, so Amber, you have one of the best, you have the 2019 IC Doctor of the Year. He's been the Doctor of the Year for the last 5 years, Dr. Robert Evans, down at Wake Forest in North Carolina. In fact, I've got to announce our winners. I have our winners. They're a little late because of COVID. Our winners for the 2019 Doctor of the Year is Dr. Robert Evans, again, much beloved by his patients. Our winner for a Nurse of the Year is Elizabeth Kusteris, who is at Virtuous Sexual Wellness and Pelvic Health in Voorhees, New Jersey. And our Physical Therapist of the Year is Rebecca Rauch at the Women's Hospital of Texas. And these are being announced in our magazine. Okay. Can I multitask or what? I'm sorry to be confusing. Amber, let's talk about this for a moment. So the American Urology Association, when they released their treatment guidelines for IC, they created a 6-step treatment protocol. Now, this is before we really started diving into subtypes, but it's really useful. It's really, really useful. And so they gave us 6 steps of treatment, and the steps are arranged with respect to the risk of adverse event. So we don't want you to do the dangerous stuff until you do the easy stuff, right? We don't want you to do surgery until you've done, things that are non-invasive that wouldn't potentially leave you with scar tissue or surgical damage. And so let's just go over there. So this is the AUA 6-step treatment protocol for IC. It was released in 2011. It was revised in 2014. And they are working on revising it again. You can go read these guidelines yourself at auanet.org. Upper right-hand corner is a link that says guidelines. Just click on the link and search for interstitial cystitis. So hi Cami, what is the first step of treatment, the foundation of treatment? Number 1, adequate water intake. Because some of you are hella dehydrated. I mean, like seriously, people. Your body is not designed to live on soda. Your body is designed to survive on water. And yet there are some of you who refuse to drink water, not understanding that that makes your urine so irritating that it could damage and irritate your bladder wall, especially if you're older. You have to drink water. Your urine should be a pale, clear yellow. If it's dark yellow, you are dehydrated and you are not drinking enough water. And I know it's counterintuitive. You're peeing and you associate drinking water with peeing, so you stop drinking water. What you're doing though is you're concentrating your urine, which is going to irritate your bladder more, which is going to give you more frequency. You have to drink water. Amber says you barely drink. Amber, that's part of the problem here, hon. We've got to dilute your urine here. We've got to dilute your urine. So let's go through this. Amber, I'm doing this for you, okay? Step 1, water intake. Step 2, diet modification. Because if you do have a bladder wall injury or Hunner's lesions, don't do what I did and pour cranberry juice on it every day for a year, because that will make it worse, much, much worse. We have supplements. The American Urology Association absolutely recommends the use of over-the-counter supplements. Why? Because they've been used for 20 years. The first supplements were actually created by IC researchers. And I think one of the reasons why is because the FDA just wasn't approving stuff. So the supplements that are the most important are supplements that contain chondroitin, because chondroitin has a bladder coating effect. So let me get those for you. Okay. So the top supplements today are going to be in my opinion, are going to be, let's go from we'll go from the oldest to the newest. The oldest one is Cistro Protec. This has been out for 20 years. It was created by Dr. Theoharides at Tufts University, a National Institutes of Health funded IC researcher. He's the guy who discovered all the mast cells in the bladder. The guy is a genius. And he was asked by the state of Massachusetts to investigate the safety of supplements as he was doing that, because he's a real geek, guys. I mean, I love him because I'm a geek too. He loves the science of it, like I love the science of it. And so here he was going through all of the supplements for the state for safety, and he goes, I wonder if this could potentially help an IC patient. And Cistro Protec was his brainchild. And he did a large clinical trial with 250 patients. I don't remember how long they took it. I think it might have been a year. It was published in the Canadian Journal of Urology. And so Cistro Protec has been the top supplement, had been the top supplement for 20 plus years. And it has chondroitin for a bladder wall effect, a protective coating of the bladder wall, combined with quercetin for an antihistaminic effect, and an olive oil base to help it absorb, right? But they had a little problem with Cistro Protec last year. The capsule contained titanium dioxide, which can cause lung cancer, and they had to add a cancer label to it. It's gone now anyway. It was just a debacles. It's now back. We didn't have it for 9 months, but it's back. It's the same thing, just a different capsule. All right. Because this is an older formula, and because we've learned a lot about IC since then, specifically that a lot of nerves get irritated, we were waiting for Dr. Theoharides to create his next formula, but he signed a non-compete agreement when he sold off the licensing rights for Cistro Protec, so he can't do that. He can't compete against his own brand. So another doctor, Dr. Gio Espinosa, out of what's the name? He's in New York. He's a director of integrative urology it's right there on the tip of my tongue. Anyway, lovely, lovely man. I've met him several times. He's another energizer bunny. So much energy. It's amazing. He created his next generation supplement about 6-7 years ago called Cistro Renew. So it has the baseline ingredients of Cistro Protec, but he added a little bit of aloe for the soothing effect, combined with lemon balm for a nerve calming effect. This is not citrus lemon. This is a mint with a lemony scent that in research studies has been shown to have a bit of a sedative effect. And so his goal with Cistro Renew was to protect the bladder, but have a nerve calming effect. And so quite a few patients switched from Cistro Protec to Cistro Renew. They felt it was a better formula, but some went back to Cistro Protec. They just love the Cistro Protec formula. Okay, so this has been around. But then 2 years ago, well, actually last year, we had a big research study from Europe that came out that showed that another ingredient, palmitoethanolamide, is remarkably successful at reducing pain in IC. We had our first formal research study presented at the American Urology Association conference last year, which showed that a combination of PEA and resveratrol was stunningly successful at reducing the pain of IC in patients not responding to other therapies. And in that study, at month 3, 87% of these patients had a significant reduction in their pain. By month 6, 25% were pain-free, and the rest were doing quite well with better symptoms. So where is it? Where did I put it? Bladder Rest came out last year. And so it has the chondroitin effect and the quercetin effect, but it also has PEA in it for reducing pain along with some probiotics. And so this one very quickly became very, very popular. The challenge with Bladder Builder is that it has probiotics in it, and some of you are sensitive to probiotics. Especially, I was just working with a patient yesterday or the day before who had been on massive antibiotics for a long time, and her biome was messed up, and Bladder Builder was just too strong for her. But if you can take acidophilus successfully and not flare from it, then Bladder Builder would be interesting. And to have something that actually reduces pain, proven in research studies, for when so many of you have been forced off of your pain medicine, is was to me a very, very big priority, which is why I was the one who said, hey, let's try to put PEA in it. And that's what they did. And this formula, this company, Natural Approach Nutrition, they work with the top IC researcher in the United States, Ken Peters. And so all these formulas kind of get vetted through this whole process. So Bladder Builder is a really strong, robust formula. But for people who are more sensitive, hello, me, where you can't take a lot of extra stuff, there's a much simplified formula called Bladder Rest, which doesn't have anything that's particularly provocative in it. And this is for people who tend to react to more things like, like probiotics. And so the Bladder Rest has been out also for about a year. And then for those of you who don't have a bladder wall issue, but your primary issue is pelvic floor, along with some nerve pain, we have Peora, which is a close match to the formula that was used in the research study that was presented last year. This is just palmitoethanolamide and resveratrol. And so this is what I take because I don't have bladder pain anymore. What I have is nerve pain from my SI joint and my pudendal nerve. And I occasionally, just as a redhead, feel my skin gets really sensitive. And so Peora is what I tend to do now when I feel like my nerves are getting a little bit worked up. All right. So we have lots of supplements now that we didn't have 20 years ago that you could potentially try. Amber says you ordered Bladder Builder and Desert Harvest and haven't started them yet. So Amber, here's the deal. Do not start with a full dose for anything. One pill, take it, try it, see how you do. One a day for a week, see it, try it, how you do. The same is true with Desert Harvest. Quite a few people have gut intolerance to aloe products. And so, you don't just want to take a massive full dose the first time. We got to figure out if your body likes it or not. So given your situation where you're really in crisis here, and the fact that you're not drinking enough water, we don't want to throw a lot of extra stuff in your urine, which is going to make it even more irritated. You got to try to get your water intake up, hon. That's what the AUA says. So let's go back to these AUA guidelines here. Step 1, self-help. After supplements, muscle relaxation. Listen, people, if you feel better because of heat, like a heating pad, understand what that's doing. Heating pads relax muscles, right? And you can't turn that off. When you're in pain, your muscles get tight to protect you. That is called the guarding reflex. And so it may be that you've been in so much pain that your muscles just lock down. But now that your bladder's better, you're still having issues because your muscles are so hard. And so working on muscle relaxation is important. We have on our website, she says you're sitting on a heating pad right now. Right. You might want to, I wouldn't put your crotch right on the heating pad. I would put it underneath your butt cheeks if you can. We don't want to, if you heat things up, you're potentially running the risk of a yeast infection. And so, but I wear heating pads all the time. I wear them on my back and on my left butt cheek. Cara says, I have one leg longer than the other. I had a tailbone injury from a girl pulling a chair out. In addition, I have cysts from ovaries when I was a teenager. Your symptoms began mostly after you had to hold your urine for an ultrasound, right? And in addition, you had a prolapse. Girl, Amber, you and Cara, look at that. You're so similar. She says she'd like to talk, can't get into Zoom. All right, hon, you can call me this week. It's fine. Okay, let's finish this. Acupuncture. If acupuncture helps, go for it. You can do acupuncture. This is step 1. Let's go to step 2. What does the AUA say, or your next level of interventions? Look at what's top of the list, Amber. Physical therapy. You've never done physical therapy. You're doing oral medications, but you know what? They're not helping you that much if you're still peeing 30 times a day. You might be doing some bladder installations and, of course, managing pain. But this is what the AUA says. This is step 2. Physical therapy, oral meds, bladder installs. Anytime we're dealing with anybody with tight pelvic floor muscles, it's on the way to physical therapy, you go. And listen. When you go to physical therapy for the first time, their job is to study your body. Their job is to study this. They're going to start on the outside. They're going to measure your legs. You got one leg longer than the other. They want to know that. They're going to have you walk up and down the hallway. They want to see how you're walking. They're looking for tension patterns. They're going to look at your glutes. They're going to look at your core. They're going to look everywhere. We got to try to understand what the hell is going on with your muscles. And then eventually what they're going to do is they're going to do an internal exam for a man and a woman. It is the most important part of the examination because what they're going to do, well gloved, you're not in stirrups, it's super easy, you don't have to be afraid of it, is they're going to gently put their finger in and they're just going to touch muscle groups, right? They're just feeling muscles. And this is exactly how they do it. So they're going to go back to the piriformis muscles, etc. And then they're also going to, because now granted, remember I took the levators off here. They're going to go shallow because they want to touch these muscles, and then they're going to be a little bit deeper. But again, they can only go this far. I mean, it's not like it's massively invasive. Don't be afraid of it. You do not be afraid of this examination. This is the most important part of your examination. And if they touch something and it hurts, hallelujah, baby. They found it. They found it. This is great news. This is exactly what we want. So in fact, during your first appointment, we want them to find something that might hurt a little bit. Don't be afraid of it. That's a success. That's a glorious success. Amber, we can talk about that. We haven't even gotten there yet. Okay, hold on. We haven't even, you're not ready for InterStim based on the AUA guidelines because you haven't even done step 2. InterStim is in step 4. Okay. So at that pelvic floor examination, they're going to be touching muscles. If they trigger your pain by touching a muscle, that is a hallelujah moment. That is exactly what we want. And you're going to ask, okay, what am I touching? Please, what are you touching? That's it. What is it? What are you touching? Tell me now. Right? Okay. At your next appointment, their job is then to go in and work with that specific muscle group. And we work with muscles in different ways. Okay. Step 3 is cystoscopy with hydrodistension or Hunter's lesion treatment. Okay. That's because these are much more aggressive and they run the risk of side effects. Having a cysto, especially and it's usually done under anesthesia, can cause side effects. And it's a risk. You're being anesthetized. If you have Hunter's lesions, they are treated with fulguration or lasers, a steroid injection or Lyris. That's how they're treated. So Amber, and for anybody out there, anytime you're going to have a hydro, you always ask the doctor beforehand, what are your plans if you find lesions? Tell me what your plans are. Are you going to treat them? And if the doctor says no, you're going to say, why? Please treat it. If it's there, please treat it. Don't make me have another test. If you find something, treat it. Let's talk about it. Step 4 in the treatment protocol is neuromodulation, also known as InterStim or urgent PC. So Amber, urgent PC is done at the ankle. I did urgent PC 27 years ago. It was just under a different name. And that's where they access the same nerve where it's the closest to the surface of the skin, which is at the SP6 part above the ankle. And I think I can show you, let's see if I can contort myself. Let's see if I can find, so here's my tattoo. You can see that little black spot. That's where they put the needle. And it was urgent PC that broke me out of my pain flare. By the 4th treatment, I was finally getting some pain-free periods. In contrast, InterStim requires surgery. It involves an incision to implant a lead by your sacrum potentially, or your pudendal nerve, depending upon which one they're doing, sacral neuromodulation or pudendal neuromodulation, as well as the implantation of a generator device by your at the top of your butt cheek. there are hundreds, potentially thousands of adverse events filed with the FDA about InterStim. And I would be happy to talk with you about that. If you come on over to our website, icnetwork.org, go into the InterStim area, read what we say about it. It shows you how to research the FDA database so that you have your eyes wide open about what you're getting into if you're going to do InterStim. Most people start with the ankle stimulation first because there's no surgery required. And it's the same nerve. It's just, they're just targeting it down at the bottom of your leg where it's closer to the surface of your skin. IC subtype 5 is cyclosporin. Cyclosporin is much more aggressive therapy with pretty severe side effects, but it has been a miracle drug for some people, especially those with profound inflammation. And then step 6, the last step, is surgery. This is rarely done. Rarely done. But in some cases where the bladder is very small and scarred, then removing the bladder or augmenting the bladder might be the best course. The treatments we no longer do are long-term antibiotics, BCG, RTX, racinoferipaxine, silver nitrate, chlorpactin, high-pressure hydrodistensions, and long-term steroids. Okay, so Amber, using the AUA guide, the AUA treatment protocol, which puts the risk of adverse event as the #1 priority. They want you to do the safe stuff before you do the hard stuff. InterStim would not be considered until you have a proper pelvic floor assessment and, if necessary, pelvic floor physical therapy, because we have a national research study conducted by the National Institutes of Health which shows that pelvic floor physical therapy is remarkably successful at reducing, if not eliminating, symptoms in many, many patients. So it sounds like your doctor is just dead set on focusing on the bladder when we have to look at muscles. You're straining to pee and you have a prolapse. Those all point to muscles, clearly. There's a website called Pelvic Guru, pelvicguru.com, and you can search their database for pelvic pain specialists, and we have a database on our website too. It's just not updated. Who has time? All right, well, I got to start the Zoom meeting, guys, so hold on a sec. Let me start the Zoom meeting. All right, so this is the point in the meeting where I invite anybody who wants to come into Zoom to share their story and ask questions. We still leave Facebook open. We still leave YouTube open. You guys are going to hear this, but you're not going to see them like I'm going to see them. So I'm going to put the invite in Facebook. Here, hold on. God, I'm always so afraid I'm going to accidentally turn off a meeting. Lisa says, my symptoms began after having a DNC from a miscarriage. Right. So Lisa, we have to look at your muscles. All right. So Facebook, you guys now have the invite for the Zoom meeting. YouTube. Hello, my friends on YouTube. Here is your invite. This is the perfect time for what we call a bio break. It's time to go to the bathroom and get a drink. And you guys, when you come on into the Zoom meeting, I will let you in one at a time, but I'm going to go use the restroom myself. So 1 minute break, go do what you need to do and meet me back here. All righty? I'll see you in a bit. Smoke is just rolling in. You say the price of my love's not a price that you're willing to pay. You cry in the tea that you hurl in the sea when you see me go by. So sad. That's my current song. I can't stop singing it. Alrighty. Hold on a sec. Wait. All right. Melinda, welcome. Eric, welcome. I have to hold on. Can you guys see me? I can't see my I can't even see myself. Oh, yeah, because I haven't started my video yet. All right. Testing 1 2 3. Testing 1 2 3. Hello Zoom. Hello Zoom. Invite Beverly. I'm going to let you in. Invite. I don't recognize your name. I'm going to let you in, but guys, any misbehavior, and I'm going to kick you real fast. Sometimes we get invaded. So let's see how we do here. Welcome. Testing 1 2 3. Testing 1 2 3. Hello Zoom. Hello. All right. So that song is from Hamilton, and if you've seen the performance of Hamilton on Apple Plus, oh, I'm just in love with the guy who plays King George. He's so good. Oh, he's so good. All right. So again, Facebook. I'm going to post your invite one more time. There you go. YouTube. Hi, Jessica. Letting Jessica in. Facebook. YouTube. Here's your invite again. Donna, you're sweet. Thank you, hun. Ah, life, right? All right, Cammie. We have an iPhone joining. Whoever you are, iPhone. All right. So let me set my computer up here, and we're going to switch right on over to Zoom. And you guys, I am going to come back, and I will look at stuff. To understand on Facebook and YouTube, I'm focusing on Zoom, and then I will come back and after we're done and go back to the Facebook chat and the YouTube chat. Okay. My friends on Zoom. Whoa, oh God, dang it. Oh, I hate it when I do that. All right. Well, let's start with Eric. Eric, my friend. Oh, here, hold on. Let me let Lisa in. I'm going to mute that. Oh, wait, hold on.
Hi, can you hear me?
I can definitely hear you. And give me
Great.
a second here. Okay, everybody is muted but Eric and I. So if you are, please don't unmute yourself until I call on you, okay? All right, Eric, my friend, how are you today? How is life treating you?
Well, I've been pretty good for quite some time. Actually, last August, I went to a pain rehabilitation center thing at the Mayo Clinic for 3 weeks, which was really good, and learned that I had central sensitization.
Yeah.
I've been really doing well the last few months, except I took myself off my antidepressants, which is never a good idea. And that tends to be when I start to flare.
Right.
So, and also, so what's happened is, and this is typical, is that, and this is what I don't understand is, and I've been in the Mayo Clinic, talked to doctors, and it's always really frustrating, but bowel activity can make symptoms flare up.
Oh, yeah.
And right now what happens is, I'll have, and it's very IBS-y right now, very, diarrhea, etc.
Yeah.
And what happens is my penis will feel like this incredible pressure in it after about 40 minutes. Like after I initially have the bowel movement, urinate, could be fine. Then by about 40 minutes in, all of a sudden everything's just going haywire. And I'm like, what is going on? And I know it's nerves, etc., but I can't make sense of it,
Okay.
and how to deal with it and how to fix myself, I guess,
Okay. So a mind-blowing new research study just came out like 3 weeks ago. And it was a study of men with testicular pain and scrotal pain.
What?
Whoops.
You're talking, and Siri wants to hear you.
Here, hold on a sec. Hold on. I have to, you guys, please don't unmute yourself until I call on you. All right? All right. So we have this new research study that talked about men with testicular pain or scrotal pain. And what do you think they found?
I don't know.
Hip problems.
Oh.
Hip problems. 70% of these men had what Dr. Weiss calls a mechanical injury of their bony structures, putting pressure on their organs and muscles in their pelvis. So in this study, and it was either presented at the American Urology Association this year or in one of the recent journals. I don't remember the source, but I just read it. It was the first study on testicular pain that pointed directly to dysfunctional muscles and bones as a source of your pain. And it was really exciting.
And that's what I figure is that, this just didn't come out of the blue. And over time, as, I've had flares up, things have they can be in the same area, but they present differently and stuff. And I know that there's nerves and muscle in there. I'm not exactly Mr. Athletic, and I've let my weight get out of control. So I'm trying to figure out how to get myself kind of back in quote unquote alignment.
Well, I mean, it really starts with somebody who will study your pelvis correctly. You'll never figure it out on your own. You won't.
Yeah, that's true.
You can't get inside of the box here and figure out what's going on with your muscles. And I'm happy you did you go to Mayo in Minnesota, or did you go to Mayo in Florida or Arizona?
No, I'm in Minnesota. I've been to Mayo, Minnesota, and I've seen people, I saw the people at Pelvic, Stephanie at Pelvic Health Rehabilitation Center and stuff like that. I've been through all that. And
okay.
They just could never find anything.
Okay, so wait a second. You saw Stephanie at Pelvic Health and Rehab?
Mm-hmm.
Like the former president of the International Pelvic Pain Society, Stephanie.
Yeah, I was actually her first customer in their Los Angeles office. Okay,
what did she find? What
she said to me, she said she thought it was more of, she couldn't, because of my weight, she couldn't do as much work as she wanted to, like on my abdominals and stuff like that.
Okay.
And internally, everything, and I've had a few internal examinations, and they always say they feel fine, my internals. So I don't think she was ever...
So Stephanie said your pelvic floor is fine. Did she find any tension at all?
She couldn't assess me as well as she wanted to, she said, and she really felt like she couldn't help me. I mean, it was a little... And the thing that seemed to really help calm things down was when I started taking antidepressants, and that really seemed to calm the nervous system down. But I don't think there's something got to be mean, these nerves just don't go crazy by themselves.
Well,
It's got to be
okay, so how old are you?
56.
Okay, and when did your symptoms begin?
Well, it all started about when I was 43, and then they gradually have gotten, as things have come and gone, because I've obsessed so much and read so much and started, they've continued to kind of grow over the last 13 years.
Okay, but so tell us what was happening when you were 43. What was happening in your life at that point in time? Was there any event that you associated with the onset of your symptoms?
Yep.
Okay.
I woke up one Saturday morning and I had to pee like every 15 minutes. And I was freaked out, and I went to the emergency room. And looking back, I'm thinking it may have even been a high blood sugar event, but I started, they didn't find anything at the ER. And so I started to go down the rabbit hole of prostatitis, and that's where I discovered interstitial cystitis and everything. And it just spiraled. I mean, I had urodynamics done, cystoscopy by Dr. He was the leading guy at Northwestern Hospital. The old guy.
Anthony Schaefer?
Yes, he did my cystoscopy.
Okay.
Didn't find anything inside my bladder at all,
Okay, so he said your bladder looks normal.
Yep, he did.
Okay. Has any other doctor looked in your bladder and said your bladder is not normal?
No, that was the only time someone looked inside my bladder.
Okay, that was the only time. And how long ago did that happen?
That would have been, 13 years ago, roughly.
Okay. If your pain is getting worse rather than better, or you're not responding to therapy, it is time to stop for a moment and revisit the diagnosis. Do we know what we're treating? Do we understand clearly what we're treating? Because again, now we have much greater respect to the varieties, the variation, the other structures that can also trigger the symptoms we associate with frequency, urgency, pressure, pain. What was your career back then? What were you doing? What was your job?
I worked for Redbox. I was an executive with Redbox, and we're a growing company. So
were you under a lot of stress? Were you trying?
Oh yeah, we were working major hours and stuff. It was fun stress, but it was stress.
Okay. Were you sitting for long periods of time?
Oh yeah, I'm a notorious sitter.
Okay. And so we remember we've talked about compression injuries, especially as you get older, where our body is not designed to sit for long periods of time. And you've got, and I mean, it's not quite the same, but if you understand why sitting on a bicycle is so bad, because when you're sitting on a bicycle seat, it's pushing directly up into your pelvic floor and onto the pudendal nerve, right? But long-term, it's the same thing. It weakens muscle. It makes you more vulnerable, et cetera, et cetera, et cetera. The good news is that amitriptyline helped. Okay, so we know based on the Mayo Clinic that you've got central sensitization like I do. And so it is always going to be in your best interest to do anything and everything that you can do to calm your nerves down, right? And this is a circumstance where something like Peora would be really interesting to try, because if you go over to the National Library of Medicine and let's just do that, hold on a sec, let's just do that so that you can see all of these research studies with it. Here, hold on a sec. Let me just.
So while you're doing that, Jill, so what I sense is that over the years, just from the constant sitting and maybe, with weight and everything else, lifestyle, I don't think I've entrapped my nerve, but probably irritated it. Is that fair to say?
Well, do you have any pain shooting down your leg?
No, not at all.
Sciatica? Do you feel a sense of vibration? Do you feel like you're sitting on a cell phone on vibrate?
No, not at all. Don't have any of those typical, what I call pudendal things. It's, I went to the Mayo Clinic and saw a GI doctor, and I said, why is the after a bowel movement, irritating? He said, well, that kind of something's happening with your pudendal nerve.
Well, that's true. That happens to me. It started in my 20s, where my feet will tingle about 5 to 10 minutes before I have a bowel movement. Anybody, Donna's not, Donna, you too? Yeah. And that's just because the nerve is just proximal to your large intestine. And as something's moving through your large intestine, it's just pushing on that nerve. You're feeling it down your leg into your feet. And I remember when that started happening in my 20s, I thought I was insane. I was laying on my couch reading, going, what the hell is this? Please, God, why are my feet tingling? You know, right? And that was just, again, that was, you know, proximity. And when you look at this as an example, all right, where's my bowel? Here's my bladder. Where's my bowel? Hold on. Here's my bowel. You can easily see this in this because when we start putting the organs back into the small confined space, I don't have my levators in, but you can easily see how a nerve that's coming off the sacrum is going to go right past the large intestine. And so, okay, but you're not having any vibration or anything like that.
No, but it's not constant. You know, like I said, it seems to be activated by when, you know, high stress, or like I said, I'd been off the antidepressant, and I think that helps calm the nerves when it's fully in my system.
Yeah.
Which I've been back on for a week now.
Yeah. So let me just show you guys for a moment. I'm just going to share my screen for a moment. All right. Y'all can see that? See the blue screen right here? So I'm at pubmed.gov, and this is where I go for all of my information. This is the National Library of Medicine. And so if we just search for palmitoyl ethanolamide, OLAMID, there you go, there's a mouthful. We can look through, so it immediately is bringing up all of the studies and lots of free articles here. So here's a meta-analysis of PEA for pain. And let's just see what that says real quick. We conducted a meta-analysis to examine the efficacy of PEA for treating pain. Results, we identified 10 studies and data from 786 patients who received PEA. 8 trials included a control group, yada, yada, yada. And the conclusion is PEA may be a useful treatment for pain and is generally well tolerated in research populations, but they say we need more. We need more. So anyway, this is where here's a study of PEA and transpolydatin for endometriosis. Here's one, the pharmacology and first data on the therapeutic efficacy. And so look at all these studies. Just look at all these studies. They have been studying PEA. There are 844 articles in the National Library of Medicine. The role of PEA in depression. So I encourage you to go through these. Micronized PEA reduces joint. Here it is, PEA in palliative care. Here it is in depressive disorder, double-blind placebo-controlled study. Autism, inflammation. Palmitoethanolamide prevents neuroinflammation, right? So, I mean, I think that it might be interesting, given the fact that you're struggling with such intense nerve pain, it might be interesting to look at that. I don't know. I mean, you're still a mystery. I mean, listen, it's 13 years later. Don't you think it's time that you maybe, given the fact that your symptoms are still pretty aggressive, don't you think it might be time for somebody to maybe take a closer look at your bladder?
Yeah, I mean, I'm in Minneapolis, so I'm guessing, or I'm close to Minneapolis. I'm guessing there's someone there I could find.
Steven Siegel's practice in Minneapolis, we've had patients go to. That would be
He's real good.
He's been around for a long time, and I've had patients say very, very good things about him. I've met him a couple of times. I don't really have any experience with him as a doctor. I can just tell you that other IC patients have gone to see him over the years. So he would be a doctor that would, and there was another doctor who just retired who was really, really good. He was very good with pudendal neuralgia. But, you know, I mean, the AUA says, listen, if you're not responding to therapy, if you're getting better, not worse, then at some point in time, it would be reasonable to let them take a quick look, even just a plain cysto, just to see if there's anything funky going on with that or with your prostate. But on the other hand, too, I think it's really important to consider the concept of mechanical injuries. You know, you are at your age, at your career, sitting for long periods of time, high stress, which means high pelvic floor muscle, pelvic floor tension. Yeah, you saw one of the best in the world, Stephanie, but she couldn't quite figure it out then. Maybe it would be interesting to go have another pelvic floor physical assessment and see if they see anything new now. Right?
Okay. Yeah, yeah. Because I mean, it could be if the bladder is fine, then it's functional, right? It's
well,
your muscles.
listen, if your bladder looks normal, it's not your bladder.
Right,
it's
right.
outside of your bladder, right?
Yeah.
And so at this point in time, based upon the information you have, your bladder seems to be pretty good. The challenge is you're still continuing to have symptoms, and we need to try to figure out why, right?
Right.
So, you know, I also think that, you know, now you're getting in the car. Hey, man, you're taking us on a trip, aren't you?
We are.
Breaking Through Chronic Pelvic Pain. I mean, seriously, you need to get this book and read this book.
Okay.
Okay. Because I think it'll help you understand, especially before you see your pelvic floor physical therapist. So you really understand the anatomy and what they're working on and what they're studying. Okay. And go to the section on prostate pain too. I think you'll find that, I think you'll just find it all fascinating. All righty. So we don't have enough info. We don't have enough info right now to be able to make a really good concerted, you know, guess. It's either one of two things. It's your pelvic floor or your bladder wall, but your bladder wall appears to be healthy based upon a test. Your pelvic floor might be healthy, might not be healthy. We don't know. What we do know is your nerves are involved. You've got central sensitization. You've got to do everything you can on a daily basis to calm your nervous system. And maybe adding a little bit of Peora might be a little bit helpful. Take a look at the research, talk to your doctor, and see what they have to say. Alrighty, you're free. Your screen has just frozen. So I think that you and I are, oh, there you are. You're back again. You're in the car now.
Yeah.
All right. Okay, so Eric, keep in touch.
Yes, thank you, Jill.
Let me know, okay?
All right, bless you.
All right. And if you want me, I can find that article on testicular pain and prostate pain in the hip. You pop me an email.
Okay.
ICnetwork@mac.com, and I'll try to find that for you, okay?
Thank you, Jill.
All right. See you later. All right. Jessica, are you there?
I am here.
How are
Can you hear me?
I can hear you, but I cannot see you. Can you turn, oh, hold on. Can you turn your video on? If you don't want to, that's fine. You don't have to. Okay, you just muted yourself.
Sorry. The video, it's not letting me. I was having the same issue last time. It wouldn't let me show myself. You had to send me something.
Okay, I just sent it.
Thank you.
Sent it to you again.
There we go.
All right. All right, hon. How are you doing today? You look great.
Oh, you're sweet. I feel like that. I went and saw my urogynecologist.
Okay.
She asked me a ton of questions, and then she had done a catheter in order to do like a microgen test, but it was called something else. I think it was something more inclusive, like pathogen.
Okay.
She wanted me to up my vitamin D. She has me going for testing for a bunch of stuff.
Good.
Which is good. But unfortunately, in the meantime, you know, my pain it still increased. It's I'm barely hanging on, but my pain got so bad, I called my pain doctor, and he was like, well, what have you tried before? Because I had gotten in a car accident years ago. So I was like, well, I know I've taken Scalaxin, which helps. It's a muscle relaxer, but also helps with nerves.
Okay. Okay.
I was okay the first day. By the second day, I was on the back, throwing up in pain.
Holy hell. Okay.
It was my back a spear, like a tribal long stick spear, and speared either through my stomach to my back to stomach. I don't know which one came first, but it was I was supposed to go to the hospital, afraid to go and bring COVID back to my father.
Yeah.
So
understandable.
So
when was that?
I
Was
wanted
that
to
this
die.
week?
That's for sure. I was quite suicidal, and I'm a psychologist. The pain was so bad.
Yeah, I've been there. I get it. I totally get it. Okay, so this just happened this week, right?
Yeah, and luckily, I got a hold of my pain doctor, and because I've had a history of back issues, he and I agreed we're gonna do like a full neck, back, and pelvic floor with and without contrast to see what's going on.
Good.
Because even vacuuming would hurt my lower back. But then again, tampons always used to hurt, so it's kind of hard to differentiate if it's both of them. Is it one? Is it the other?
Well,
so I'm not quite sure there. And on top of it, my bloating has increased, and now I'm flaring. I'm just and I have my period a week early. I'm like, what is going on? And I'm having these, remember the old game Operation where it would buzz when you tried to get the wishbone out of the guy's body or whatever. Well, it felt like somebody was doing that to my back. And it was just having random spasms all the way down my back, my glutes. And I've never felt anything like that before.
I've been having that for 3 days. And that is, for me, it's like I was hit in the left butt cheek or my SI joint. It feels like when the SI joint is acting up, it feels like somebody's hit me with a baseball bat right there.
Mm-hmm.
And then the whole thing just vibrates. Like it's vibrating. I mean, I always say in every meeting, all I have to do is sit for 2 hours before it starts vibrating. It's been vibrating nonstop for 3 days, and I had to break out the muscle relaxants. And why did it start? It started because early in the week, 2 days in a row, I sat down for 10 hours both days working on stuff, and I just tweaked it out, So with your bloating, now I was working with a patient, and I don't know if I don't think this was you. I don't know. We didn't talk this week, did we? Did we talk?
No.
Okay. So
we talked last week.
So I was working with a patient who had really severe bloating, like really, really severe bloating. And we traced it back to probiotics. That it seemed like she was reacting to some probiotics. So
that's good to know.
Yeah. So are you are you taking any supplements or anything at all like that?
I haven't been. I'm supposed to go. She sent me to go get vitamin tested. But because my doctor also put me on steroids, I had to cancel my blood test.
Yeah.
Because the steroids messed the testing up. So I had to put it to a later date. So I'm trying to get a baseline, and then I can just start supplementing left and right with vitamins.
Well, vitamin D3 it's very commonly low.
Okay.
My D3 and my B12 levels in my early 40s were just so low. And the doctor was just stunned. And it's like, I didn't know. Come on, I'm outside all the time. Why would I have a problem with D3? And they immediately put me on supplements for both of those. And every now and then I forget for a couple months. It's like, wait, I'm supposed to do that. But right now I take our low acid multivitamin, which has them both in. You're doing exactly the right thing. First of all, I'm so sorry you're in terrible pain. I wish I could give you a hug right now. It's awful. And I wish you weren't going through this. You're doing everything right, though, because what you're doing is you're not accepting it. You're going to the doctor. You're asking for testing, and you're looking outside of the box. A proper analysis of, given your history of back injuries, we got to figure out what's going on with your back, right?
Mm-hmm.
And is your back pain low in your back, middle back, or upper back?
My accident caused pain in my upper mid back. But yeah, I guess that'd be mid back. It's hard to tell for me, but my mid back, and And then my lower back hurt after vacuuming. And I think that was from the car accident, but dumb old me, I was like 20 years old. And I'm like, I don't need an MRI there. I'm fine.
Right.
You know, I didn't know. And I'm like, at this point, and I've had a ton of sinus infections. So that's another reason why my pain doctor wanted to do the contrast, because he's worried about, he's like, possible spinal infection. He's like, we got to figure out what's going on.
Right.
And so
well,
at this point, I'm just trying to breathe, but I'm so miserable.
well,
and my urgency, which I haven't had for a long time because I take Percocet and I barely eat food. Like I eat so bland, it's ridiculous. So I don't know what's going on, but I'm like, how am I going to do an MRI and stay still? Because I've had one before. And have this urgency. It's
well, you're
making me crazy.
You're going to do it. You're going to do it. You're a tough cookie. You'll find a way. I have total faith that you're going to get through it with shining colors, and you're going to, I mean, when you got to do it, you got to do it. You buckle down and you do it. You'll get through it. You'll be fine. You will absolutely be fine. And we need.
I'll just take a couple of my Xanax.
Exactly. That's perfect. I mean, that's perfect. Xanax is a great way to get through medical procedures that are stressful. And so if that will do it, that's fine. When are you going to have that done?
My doctor had emailed, he's amazing. I'm so lucky to have this pain doctor.
Right.
He emailed me the script the day of, literally within a half hour. And, I'm going in, we're going to call tomorrow and see with the MRI place, what's the soonest they can get me in.
Okay.
Because he was worried about cost and spreading it out. And I'm like, my hated statement from doctors is wait and see.
Yeah.
I don't want to wait anymore. It's been 6 years of my life.
Yeah.
I want to know what's wrong.
Yeah.
I was like, I don't care what the cost is. I'll go in debt at this point. I want to have a life.
Yeah. They need to do the proper workup, and I think that your instincts are right. I think that the car accident was a pivotal, traumatic moment to your body. You sustained a back injury, but the back injury, if you had one, was never treated. Perhaps they never even really understood the depth of that back injury. And it is time once and for all to do that. It is time for them to do that proper workup. So girl, hang tough. You got your meds. You are.
Okay. And can I take that Pia stuff? Sorry, I wrote it down, but
Peora?
What was that? Peora, yeah.
Uh-huh.
Can I take that for my urgency and still do a blood test? Do you know? Or should I ask?
I don't know of any conflicts, but I can't give you medical advice like that. Ask your doctor.
Yeah.
But go through the research studies and see if you can find any reference to it. I didn't see any reference to it when I went through the papers. So, but what I do remember reading in a couple of the articles is that they felt that palmitoethanolamide was particularly effective for people with nerve-driven pain, neuropathic pain. And so,
which is what I have, like the pain's going all the way down my legs.
Yeah, but we got to look at your muscles too, hon, because the pain going down your leg is from your muscles. It's from your muscles compressing your piriformis muscle compressing your sciatic nerve, right?
Mm-hmm.
And so having an opportunity to talk with a physical therapist, especially about the vibration, you gotta focus on the vibration and say, this is what happens when I sit. And it's either a muscle that they call it a fasciculation. It's like an eye twitch. It's like a really, 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 mine right now is like really, really high pitched. It doesn't hurt, but it's vibrating. It's just constant.
Exactly. It's a weird feeling.
Yeah, it is. It is. So, if you can get back to a physical therapist and have them look at your body a little bit more, I think that would be a really smart thing to do. Okay.
Yeah, I have one appointment this coming week. So
Perfect. And you've got somebody that you can talk to when you're feeling stressed.
I have a therapist, my boyfriend of 7 years, who I don't know why he hasn't run for the hills, because I want to run away from me, but yeah. And then I'm living with my parents right now.
Perfect.
Because I'm I spent my life in school so I could work for 8 years and move back home in with mom and dad.
Hey, sounds a little familiar, doesn't it? That sounds
so frustrating. Like everyone's like, oh, it must be nice to be home all day. And I'm like,
no.
Oh, I'm going to hit you.
No.
I'm type A
yeah.
to the hilt.
Yeah.
I like to work. Sitting here, not using my brain is making me crazy. So I use that time to research about my health.
Yeah.
Researching constantly. I'm on every group you can try to find in Facebook.
And did you get this? Have you read it?
I wrote that down. I'm going to get that. But I wanted to, but between the last time we talked, I had a stomach flu and then I was on the floor in pain from my back.
Right.
I'm telling you, it's been a rough time between the last time we've talked.
Well, remember that you've never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly one day older and one day wiser. And girl, you are kick-ass strong. Because you've made it this far, and every IC patient out there listening to this, you have to understand that you're mighty warriors here. And there's a lot of people who, they just kind of go hide in their bedroom and shut the door and shut the drapes, and we just can't do that. There's a reason why you're in pain. And that is your journey now. That is your cause, is to work with medical care providers, to study your body, to figure out what the hell is going on here. And in the meantime, you got to do all the things that you need to do that will keep your body calm and your muscles relaxed, and fill your day with laughter and anything that you can do. Like you really would benefit from. Where is this book? Where did I put it?
Get my pad and my paper, or my pad and my paper, my pad and my pencil. I can't even talk anymore.
I think as a psychologist, you would find this book really interesting. It's called When It Hurts Down There, and we have it in our store. Okay. And this is all about pain and how the pain is processed, the nerves, but more importantly, it explains. It explains the 3 levels of the brain the pain is processed in the brain, and how to interrupt it at every level. And so I really think you might find this helpful too. But the most important one is the Breaking Through Chronic Pelvic Pain. So I wish you strength.
Sorry to hold you for one more second. Is there any book that would be good that's related to the pelvic floor pain? And I had a sexual abuse incident, nothing touched, but visual, when I was in 6th grade. Is there anything with sexual abuse and pelvic floor therapy, or is it just something completely different that I should handle with my mental health therapist?
Well, number one, again, this book will ground you in anatomy and help you understand what's happening with your body. Okay, so there is another book. Let me see if I have it here. Here it is.
Sorry to hold her up, guys. No, I know you're waiting to talk to her.
No, you're fine. Secret Suffering. How women's sexual and pelvic pain affects their relationships. And, I have, hold on. Look. Send me your mailing address, and I'll send you this. This is a damaged copy. Send me an email right now. icnetwork@mac.com, so and I'll send this to you. Okay.
Okay, sorry. icnetwork at what?
Mac.com. icnetwork@mac.com. You guys, anybody out there, if you have damaged books, anybody with damaged books you're not using anymore, send them back to me, because I just pass them out. And so,
yes, thank you. That's so nice of you. I really appreciate it.
Yeah. Okay.
Given I'm making 0 money.
I know, hon. I know.
So,
all right, send that to me. You got an adventure this week.
I will.
Let's see what they have to say. Okay.
All right, I'll let you know how it goes.
Keep me posted. Now, there's a gentleman named Fernando who is trying to come into the chat, but I don't see him anywhere. Fernando, if you're if you're an IC patient, I need you to say something in our YouTube or our Facebook channel, because I have to make sure you're really a patient before I let you in and I don't recognize your name. So Fernando, who's trying to get into Zoom, if you could either email me, icnetwork@mac.com, or put a message in our support group meeting that's happening live right now on YouTube or Facebook. Maybe just say a little bit about your symptoms. That would be great. And then I will let you in. Okay. Rhonda says, I need to order that Secret Suffering. Is it online? Yeah, you can get it on Amazon. I only have 2 copies and I have to keep my 1 copy. So, all right. All right. So hold on a sec.
Well, thank you for your time.
Oh, you're very welcome, my
We
dear.
love you.
Yeah, you're very welcome, girl. Hey, listen, I mean, so you're a psychologist. I have my master's in psychology.
Mhm.
My intention was to get my PhD in psychology, and I just
Yep.
couldn't do it because of my accident. And I
Yep.
could not in a car for 5 years without crying. I'm not lying.
Yeah.
It was agony.
No, I believe it. That's where I am now. That's why sorry if it's your opposing company. I don't have any affiliation with them aside from like buying things, but I bought a seat cushion thingy. I put my own thing, but the center of it is the whole center of it's lower. I got the heaviest weight, so I know it lasts a long time.
Oh, good. Hey,
and
man,
it makes a huge difference for car rides.
Okay,
So that might help you.
Yeah, send me the info. That would be great.
Definitely.
And
I'd love, if I could help you, that would be amazing because you're so helpful to all of us.
Well,
so
and
I'd be honored.
see, the thing is they just discontinued our bladder and prostate friendly chair cushions. We will not be able to get them anymore. So
Oh, man.
I'm looking for more. All right, hon.
Okay.
Great talking with you.
Take care.
Remember your strength, and remember we're all behind you and standing with you when you go into that appointment, okay?
All right. Stay safe.
100%. 100%. Right back at you. Okay. Linda, are you here, Linda?
Yes, I'm here.
All right.
Hi.
Can you, okay, you are in a very dark room.
I am because I'm from the UK.
Oh, it's
and
nighttime.
11 o'clock at night.
All right, hon. Well,
Yes.
Welcome. Thank you for coming.
Thank you.
What time is it for you? Is it like 3 a.m.?
No, it's just before 11 o'clock at night time.
Awesome. All right. Well, how are you doing? How is your IC doing?
I was in hospital not this week, the week before,
Well, darn it.
with kidney infection. I've been diagnosed with IC for quite a long time.
Okay.
I have installations at the urology department in Liverpool where I live.
Okay.
And I have a catheter into my bladder with Cystostat. I don't know if it's the same medicine that you do in America.
Okay.
I used to be on and off long-term antibiotics, which I'd have an antibiotic for a month, and then they would change that. I've had the operations where you widen the urethra. My urologist, last time I went to see him, he was thinking about Botox and freezing my bladder, and that I would have to self-categorize 3 times a day. But because I've got osteoarthritis of the spine, I said that I won't be able to do that.
Okay, so let me ask you a bunch of questions, okay? So,
Okay.
because I always I need to try to visualize it. Number one, how old are you? Whoops. Okay, she has just frozen.
53.
Okay, and how old were you when your symptoms began?
50.
I just lost you. 50. You were in your 50s?
As a child, really. I'm 53.
Okay, and how old were you when your symptoms began?
53.
So this started this year.
No, teenager.
Okay, started when you were a teenager. Okay.
Yeah.
And
but I've
does anybody
in my 20s.
Okay, here, just let me just run through questions. Okay, just bear with me here for a moment.
Okay.
Do you have any family members who have bladder problems?
My daughter used to have bladder problems. She doesn't anymore.
Okay. Are you a
Nobody
redhead?
else.
Are you a redhead?
No, I'm a brown hair.
Okay. When is your pain the worst? Before you pee or after you're done peeing?
Usually, sometimes it can be either before or after. Sometimes I have accidents because I can't get to the toilet in time,
Okay,
and
that's important.
I'm on medicine.
Okay,
For
so
that.
just so
But
okay, so just hold on. I still have to understand it before we can talk about treatment. So bear with me here.
okay.
So
I sometimes get symptoms where I can't even pee in the toilet. So I can't open and pee at all.
So you have moments when you're incontinent and you have moments when you cannot pee at all.
Yeah.
Was that true when you were a teenager? The same
Could
thing
have been
happened when you were a
younger.
teenager?
I think I used to wet the bed when I was before a teenager, but I can't really remember that much.
Could you remember not being able to pee when you were younger though?
No, I'd always have accidents.
Okay. Did you suffer any accidents or traumas when you were young?
I ended up in hospital as a child with concussion.
Say that again, with what?
Concussion.
A concussion.
Yeah.
Okay. Was that around the time that your symptoms started?
No. Symptoms started before that.
Okay. What about when you try to urinate right now? Do you urinate normally, or are you having to push it out?
Sometimes I have to push it out. Push it out.
Okay. Is your urine clear or is your urine cloudy?
It can be cloudy. I also have chronic kidney disease as well.
Do you, as part of your kidney disease, do you have kidney stones?
No, I have it. So in England, you only get to see a kidney specialist when you're just about to have dialysis. So when you're at stage 5, and I'm actually at stage 3A and 3B. I have 10 chronic physical health conditions as well. So I have fibromyalgia and I have a rare lung condition.
Okay. Okay. Do you have irritable bowel?
No, that's the one thing I don't have.
Thank God for small favors.
I have constipation sometimes, but I think that's to do with the medicine on the side effects.
Well, there is a form of IBS, it's IBS constipation, where you have long-term chronic constipation. Do you have vulvodynia? Do you have any pain on your vulva? Do you feel like you have a yeast infection, even if there's nothing there?
Yeah, I have had yeast infections in the past.
Okay, but do you have pain on your vulva? Like now?
Yes. Yeah.
It's pretty regularly?
Yeah.
Are you having normal periods?
I have a severe PMS, so I've got a coil, a Mirena coil, fitted inside me because of heavy periods and severe PMS.
Do you have fibroids or endometriosis? No. What about endo?
I have got a cyst on one of my ovaries.
What about endometriosis?
No, well, I've had 2 children, and I used to, before I had the 2 children, I bled quite a bit, and afterwards, but I've never been diagnosed with endometriosis. I've never been diagnosed with fibroids or the other condition.
Listen, you're 14 and your symptoms began. Were you having periods then, or were you a late bloomer? Were you an early bloomer or a late bloomer for your periods? Just out of curiosity.
Early.
Early. Me too. My period started, guys. You want to know when my period started? 4th grade. Donna says, yeah, 4th grade. Hey, man. And that was back when there were no such thing as stick-on pads. We had the plastic belt, and you could see it. You could see the outline of the belt on your pants. You want to talk horror stories of horror stories. Going to elementary school in 4th grade. Oh my God, that's just bringing back. I mean, we can laugh about it now, but it was terrible. You know, hon, do you have scoliosis?
I've been diagnosed with osteoarthritis of the spine.
And
hands, knees, and feet. And I'm actually in a serious pain. I have been since I came out of hospital. The pain's got worse.
Is it and where is that pain located since you've gotten out of the hospital? Is that in your pelvis or somewhere else?
No, that's part of the pain there, but it's mainly from my neck down to the bottom of my spine and my right knee.
Okay, so.
But when I'm on my right side of where my kidneys are, it was very, very painful. And they put me back on antibiotics.
When I think of children who have had symptoms, and I was one because I had frequency urgency in 7th grade, which in hindsight, I absolutely believe was muscle injury because I remember falling and breaking off the tip of my tailbone. My urethra was very narrow. I was diagnosed with a urethral stricture, and they gave me urethral dilations for a couple of years, where they stick the rod in the urethra and just stretch it out. Nobody thinking, hey, why is it tight in the first place? It was probably muscle injury back then. You know, so when we think about childhood urology conditions, it's a bit murky. We don't have anybody in the world that I'm aware of who specializes right now in childhood IC. We do know that the youngest patient I've ever worked with was 4 years old, in terms of her mother, obviously. And obviously, guys, I'm not a care provider. I'm working with them over the phone. And it was 2 twin sisters who had inherited a sensitive nervous system with their mother, who also had IC. So all 3 of them had an inherited central sensitization, exquisite nerve sensitivity. And so we would look at inheritance. If you've got super sensitive skin, if you're drug sensitive, smell, do you have a wicked sense of smell? Can you smell things that other people cannot smell, and do smells drive you crazy?
Yes, and I also have fibromyalgia.
So
I can't, if people touch me when I'm having a flare-up of fibromyalgia, I can't be touched because it's so very painful.
Right. So you definitely have central sensitization. That is, I was reading one of the new publications about more subtyping, and there's a definitely a move to have a subtype of the classic patients who've got IBS, fibro, vulvodynia, in which some cases it can be central sensitization, in other cases it could be autoimmune. You're in a pickle, hon. You're in a pickle because your healthcare system does not necessarily help you get in and figure stuff out. Have you been in touch with the United Kingdom with Bladder Health UK, which is the national?
I didn't even know. Actually, didn't even know about the Bladder UK. I've just was diagnosed with interstitial cystitis, and I just was under the urologist and the nurse specialist at the
So
hospital.
there was the first IC group was UKIC.
Yeah.
And it was founded by a lovely couple named Anthony and Annette Walker. Annette had IC. And then the next iteration of the group was the Cobb Foundation, which was a cystitis and overactive bladder foundation. And then they changed the name like 2 years ago to Bladder Health UK. I would like to see you connect with them because they can tell you who the best doctors are in the area, and they might be able to give you a cleaner pathway to find somebody who can try to help us understand what's going on. You literally are an anatomical mystery to be solved. We cannot ignore the arthritis. We cannot ignore the fact that you have other conditions which are also associated with painful conditions. I think that all you can do right now, the most important thing for you to do right now is to, when you've got so here's the way central sensitization is approached in the United States. Because I asked Dr. Peters, who's our top researcher, I said, what do you do when you have a patient with central sensitization come see you? And he said, in a joking way, but a serious way, he goes, I back away slowly. Because we understand with central sensitization that your nervous system is on a hair trigger. And it's on a hair trigger throughout your entire body. So the way my CSS manifests, on some days, it's like I'm being hit with pins and needles. I get a random needle jab somewhere. Have you ever had that? Just like out of the blue, you get a needle jab in your arm or a needle jab in your leg. And you look and there's nothing there. And it's like, okay, it's your nervous, it's just your nervous system. So for people with central sensitization, generally, they do not want to do heavy, aggressive testing because we don't want to trigger more nerves. The therapeutic priority is to fight all the fires. We were trying to reduce the volume of anything sticking your nervous system. So if, for example, you were having vulvodynia and you were having bladder pain and you were having something else, we want to make sure that we're addressing all of them. We don't want to leave one firing because it's just going to amp up your nervous system. And so kind of theory number one is let's not leave a source of pain untreated. Let's try to make sure we understand and address anything that might be hurting. Okay, so again, for me, because my SI joint got out of whack and I'm having a lot of vibration at my SI joint right now, and the nerves are on a hair trigger, the skin in the area now is super sensitive. So literally 10 minutes before I started this meeting, I had to go change my underwear because I put on a pair of underwear that had lace, and the lace was bugging the hell out of me. And I had to switch to something that didn't have lace so I could sit here. So it's something as little as that. It's paying attention to anything that's annoying you and just trying to change it. Not forcing yourself through that pain.
I think it's because, like with the doctors in the UK, is because I have got so many chronic physical health conditions, and I have different parts of my body. The pain is different to other parts of my body.
Well,
but if one pain starts off, then the whole rest of them kick in, and that's constant.
Right.
With my health.
Right. And so, it would be very good to spend a little bit of time on the internet and research the treatment for central sensitization. I mean, doing nerve calming medications makes sense. Usually they'll put you on gabapentin or amitriptyline.
I'm not on amitriptyline. I'm on nortriptyline. So for the fibromyalgia, so that.
So you're on one. That's good. But it would be, you could have a discussion about the pros and cons of gabapentin, if that would be reasonable. Certainly, there is a study with Peora and fibromyalgia, or with PEA and fibromyalgia, and so look, you might want to Google that and then see what's available in the United Kingdom. See if you can get a good palmitoethanolamide resveratrol. See, you know, find the PEA fibro research study. You'll find it, and it was helpful. It was definitely helpful, and so you might be able to get something like that in the United Kingdom that might help too. And you know, remember in IC subtype 5, the therapy over here in the States is cyclosporin, and cyclosporin is used as an anti-rejection drug for people who are going through transplants. It suppresses the immune system. And there are people who have a lot of autoimmune disorders, and that's where cyclosporin, one doctor said, he called it his miracle drug, that for patients like you who appeared to have a lot of autoimmune disorders, that the cyclosporin appeared to be remarkably helpful at calming everything down. And so you might want to read up a little bit about that. And if you want, you can reach out to me if I can see if I can find some more studies for you that you could talk to your doctor about. But something like that might be really viable. That could be. And I'm just having this wiggle of a research study that I've read in the last couple of months about that. I don't remember the specifics, but that I know it was within the discussion of talking about patients who, like you, who have all of these related conditions. Hi, Amber, I'm letting you in now. So this is what I want you to do. I want you to research central sensitization, and I want you to clean up your house with respect to chemicals. Got to get all the chemicals out of your house. Oven cleaner, Febreze, scented candles, stuff like that. Those are all neurostimulatory. And so we want to make sure that we absolutely clean up anything from your house that can trigger nerves, right? There's an article on our website about that. That's something that the Endometriosis Foundation really brought to my attention that I think is really, really relevant here. I know for me that if I have a low chemical something going on in my house, my nerves go crazy.
Well, I've got this rare lung condition which is called tracheobronchial malaise - excessive dynamic airway collapse, and it's comorbid with vocal cord dysfunction, gastric reflux disease, asthma, and sleep apnea, and they're all comorbid with that condition. And with that condition, I've done my own research on that condition as well. But the vocal cord dysfunction part of that condition, the symptoms are allergies to sprays, to smells. It's sort of like there's sort of like because when I've gone to my consultants, I've listened to what they've said and gone and done my research on each condition. Because I'm a student, but I think it is hard when the doctors in England, when you go to them and you've got multiple issues like I have, it's difficult to have one doctor to treat all of them.
Well, and you've got to do your due diligence here. I mean, I think it's very, very important that you learn about the biome, because what we're finding, you know, we're just finding more and more compelling evidence that for some people, their microbiome is completely messed up, and that's what's creating a foundation for some of this. So, so this is your homework: central sensitization. You got to look at research cyclosporin, see if there's anything interesting there. Research PEA, look for the PEA fibromyalgia study. That might be really viable for you. And there you go. Listen, I gotta go get my yoga ball. I can't sit in my chair because my sciatica is hurting. Hold on. All right.
I want to say thank you.
Very, very welcome, my dear. Very, very welcome. Okay, so that was my first pain hit. That was for my first SI jab sitting here. It was just, oh wait, okay. Look at my ball is losing air. Okay. All right. Okay, hon, that's your homework. And hopefully feel free to give me a call. I mean, well, calling from England doesn't really work. Pop me an email and let me know how you're doing, okay? And if you need help I'll finding stuff, I'll see what I can do, okay?
Okay, thank you.
All right, hon, you are very, very welcome. Amber said here, Amber was trying to get in. You had no audio on Zoom. Amber, you had to turn it on. You'll figure it out. And hon, Amber, I'm happy to talk to you this week too. All right. Melinda, my dear, Melinda, what are you doing today?
Better today than I was earlier, later last week. I was not doing too well at all.
Okay.
But listening to, I mean, I was in not near as much pain apparently as some of the others I've been listening to, but severe enough that I just was going out of my mind. It hurt so bad.
Right.
But I didn't know if it was the storms coming through or, combination of things. I'm not really sure what that was all about, but I do. And I feel like my IC has gotten worse over the last year. Are you sinking?
I think my ball is starting to lose air.
Oh dear. That's not good. If you end up on the floor, just roll over. Don't go cling to the bottom. But anyway.
I have another chair too. This one. The key is to keep moving. I'll just keep moving.
That's okay. You're fine. Last year, well, let me just start the year before that. In 2018, I was diagnosed with ulcerative colitis, and I was also, everything was precancerous.
Ooh,
so,
okay.
Yeah, they tried me on some medicine for UC to begin with. I did that for about 6 months, and nothing changed. Everything was still the same. Then in 2019, I had surgery to have everything from the small intestine down removed. That includes the anus, the rectum.
Oh my God,
everything.
Girl. Okay.
So I have an ileostomy. And
okay.
I also have more pain directly in the urethra than I have necessarily in the bladder itself. It just feels like, it's like I told everybody this week, the pain feels like there's a 10-pound weight on my bladder with jabbing ice pick pains into the urethra.
Okay, when did that pain start?
The urethra pain?
Yes.
I've had that for the last, I want to say 3 or 4 years.
Okay, and how old are you? Can we say genitourinary syndrome of menopause for the win? So yeah. You are genitourinary syndrome of your urethra is a canary in the coal mine. Estrogen atrophy, and it's the urethra that's often going to be the first to start screaming when your estrogen levels drop to a point that your tissue can't produce mucus anymore. So the urethra, the bladder, the vulva, the vagina are all part of what we call the urogenital sinus. So they all derive from one common cell. And then they diversify to create all four structures. And so the reality is that they are all remarkably hormone driven. So that nice thick mucosal layer in your bladder is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. When you're older, you have much less estrogen, much less mucus. And so what it feels like is, because it happened to me when I was like 51, 52. I can't believe we're older. I still feel 25, and yet I look at the wrinkles and go, damn it. I want to be 25 again. Damn it.
I know, who put those there, right?
It's so weird. It's so weird to be older when we feel so young inside. And so anyway,
That's just it. I don't feel so young inside anymore.
Oh, well, okay.
Well,
So
after years I had my first colonoscopy when I was 49.
right.
And I suffered for years before that with diarrhea. And the only reason they did that was to do the colonoscopy then was because I was complaining.
Right.
And I said, I want to find out what's going on.
Right.
Well, they found nothing. So I went 11 years and then had another colonoscopy, and then everything was bad.
Everything went to hell.
Yeah.
So getting back to your urethra for a moment, the urethra is kind of like the canary in the coal mine. And when it loses estrogen, it starts feeling like there's something stuck in your urethra. It feels like there's a painful drop of something stuck in your urethra. And then your urethral symptoms just get worse and worse and worse and worse and worse and worse. And so, is your vulva dry? Is your vagina dry?
Yeah.
Okay, then so's your urethra.
Yeah.
And so you need to have a doctor look at your skin. I mean, you have to be dry. There's no way you're not dry.
I drank a bunch of water.
I know, but that does nothing.
That's not going to help. Okay.
Yeah, because remember, your mucosal membrane is your cells are hydrophobic. They repel water. Their purpose is to keep water off of the cell. So they're purposely to repel. And then, so is your mucus to a certain extent. So water isn't going to do anything. It's really about kind of a lipid base. It's actually a sugar base. It's a glycosaminoglycan base. But anyway, your body uses estrogen to produce mucus. And so that is a very good, solid, I'd say 80% guess as to why your urethra is screaming. Okay. Because I have this conversation all the time. And so you got to get that checked out. And generally what they will do is they will give you a hormone cream. They'll give you estradiol, estrogen cream, something like that. And they would normally have you put a pea-sized drop on your finger and rub it right into your urethra. That's what they told me to do. And it works like a charm. Works like a charm. Okay.
Okay. Sounds good.
Yeah. Yeah. How are you doing with now you have an ileostomy?
Yeah.
And how is that maintaining that for you?
It was challenging at first, but I also ended up in the hospital for a month. Okay. And you were supposed to, anyway, I had infection after infection. Right. And so they kept trying to figure out what medicine was going to work to get rid of it and all that other kind of stuff. But anyway, they finally figured it out. I was sent home. The healing process because they took the rectum out and everything, there's several different ways of doing that and healing that wound. Some just stitch it up and then it pops loose later. And they didn't do that with me. They healed it from the ins out with using gauze, dry gauze, then damp gauze, then, saline saturated and all that good stuff. Right. Really painful treatment. But anyway, you live through it. So other than that, getting that done, I still have not been released from my surgeon since June. It's been a year since I've had the surgery because she just took the skin tag off 3 weeks ago or 4 weeks ago and ended up hemorrhaging after that too. Well, they asked me if I'm on Elmeron and I told them I'm on a blood thinner and they said, oh, okay. So I think what they did is just went ahead and did it and put clotting gauze on it afterwards. Okay. But it came out the next time you had to go to the bathroom, I mean, not really smart because it was really closer. The skin tag was closer to the urethra than it was to the rectum area. Interesting. So it was, very hard place to have one. It hurt when you sat. Anyway. I'm sorry. So it still hurt to say. I'm sorry. Listen. What do you do?
I mean, you are, I was reading a story of a woman who had HPV driven rectal cancer. And so they did a posterior something surgery where they removed everything. They removed
Mm-hmm.
everything, and was going through her recovery. And
Yeah.
I thought having a hysterectomy was brutal, and you did something so much harder than what I did. You know, do you agree with
Yeah.
1 year healing, that it takes a year to really start to
Oh,
heal
yeah.
from something like this? Yeah. Yeah.
It really does. It really zaps it out of you the older you are. I
Yeah.
mean, it really just zips it. I mean, it's still, and because of COVID, you know, now you can't go do anything. So I am trying to exercise at home, but you know, with the bladder pain, the more, you know, exercising you do, bouncing around, doing all those things, it's just like, oh my word, I hurt worse now than I did.
Yeah.
So,
Yeah.
you know, so I do try to do it anyway when I'm not in a flare,
Right.
but it's, you know, it's still.
Well, you haven't been released. You're still a post-surgical recovery
Mhm.
patient. So what you've got to do is at least, I have a really good blog on our website, The 7 Causes of Urethral Pain. I would encourage you to read that.
Mhm.
Just go to
Okay.
icnetwork.org. And then if you can, make an appointment with your doctor and have them look at the quality and health of your skin. And let's see if there's anything
Okay.
funky going on. Okay.
Sounds good.
All right.
We'll do it.
All right. Thank you so much,
Thank you.
guys. I need one quick break. I'll be right back. Hold on. Sitting on this ball. All right. Let's try this again. Donna, my dear, you have been waiting patiently so long. We have, now you guys, and we got, actually Amber, Donna, Amber came in first. Can I go to Amber? Would you mind? All right. Amber, I think.
Hi.
Actually, Amber, you came in afterwards, but you know, let's do Amber first because her case is really, really interesting. Hello, hon. It's nice to see you.
Hello, you too.
Yeah, yeah.
Sorry, this is my first time using Zoom.
Well, it's kind of weird, isn't it?
Mm-hmm.
It's kind of weird. And on my end, all I'm getting is this big picture of myself and I got smoke everywhere and I look orange and it's terrible. So anyway, just ignore how I look right now. It doesn't look good.
Amen.
Okay, so we were talking with you earlier. So let me just listen. I want to go back and this is on YouTube where I'm actually allowed to scroll back and look at something. Your case is very, very interesting. You were doing hydrodistensions every 3 months.
Yep, my last one was on the 17th of this month.
And you're 30 years old. Your symptoms started, how old were you when your symptoms started?
Pretty much as a teenager,
okay.
But we really didn't put it together. I've always had microscopic blood in my urine since I was 2.
Yeah, but that's, you know, it's not concerning. I've always had microscopic blood too. We're not that worried about microscopic blood. Here, hold on. Let me just look at your thing here. So you're scheduled for interstim in October. You're peeing 30 times a day.
Mm-hmm.
You've always had pelvic pain. 16, it got worse when you were a victim. Mm-hmm. So describe the pain for us. What does the pain feel like?
I always have the urgency, of course. So like, I gotta pee, gotta pee, gotta pee.
Okay.
And the pain, whenever the way I describe it is I'm in labor, the head is ready to come out, I'm ready to push.
Okay, so that points us right to muscles. Anytime there's a pushing or pulling sensation, we're always thinking muscles. So, so this began when you were a teenager. Do you remember any accidents, any falls? Were you a bike rider? Were you a gymnast, an ice skater, dancer?
I rode my bike a lot.
Okay, well, that's important.
That was it.
Yeah, but
Yeah,
that's
that was really it.
that's important because we have something that we call bike rider syndrome, also known as pudendal neuralgia, which is very common in people who ride bikes. You know, because when you're sitting, you know, when you see, and I have a picture of it. Actually, we've got a picture of it in this book here. You're putting immediate pressure on the worst, most vulnerable part of your pelvis, which is the muscles and the nerves. So did anybody in your family have any problems? Anybody at all? Anybody else have any bladder issues?
And my mom is starting to have more as she gets older, of
Yeah,
course,
that might just
she
be
pretty
menopause. Yeah.
she describes some of the same symptoms that I do as far as like having to go. She drives Uber and she'll take a trip and then she's got to go to the bathroom. She'll take a trip, got to go to the bathroom. But she's never seen anybody about it.
But how old is she?
She's 55.
Okay, so in all likelihood, if she didn't have issues when she was younger and it's starting at 55, it's estrogen atrophy. So you need to get her to learn about that, to learn, we call it the genitourinary syndrome of menopause. Okay, so let's look at this. I don't know if you can see this for a moment.
Yes.
Okay, so this is a picture of a bicycle seat. And you can see that the seat is pushing immediately up against not only your pelvic floor muscles, but specifically the nerves. And so this is why I was just reading a paper about it, about women rider. Why do cyclists today? Oh, no. It was a paper, I think, presented at AUA this year about female cyclists have numbness. And have you ever had any numbness down there on your butt cheek? You ever
Not that I can remember.
Ever have any shooting down your leg?
No.
Do you remember any falls when you were a kid? Anything? Do you have any bike accidents?
No. I was molested at 12.
Okay.
But that's really the only trauma.
I'm so sorry. I'm so sorry that happened to you. You'd be stunned at the number of people that I talk with that where that's happened.
It's sad.
It's
disgusting.
Beyond disgusting. I mean, it's just, it should never have happened. And I'm so sorry that it happened to you. When we go back, you know, we could spend years and years and years trying to say this caused it, or that caused it, or this caused it, or that caused it. And it's ultimately, it's a bit of a waste of a time. There's no way we can say, was it a bike accident? Or we can say, was it that you were a victim? What we can say, though, is you did suffer some sort of pelvic trauma. Okay. And so that trauma would have been related to muscles and potentially between the bicycle seat and the pressure that puts on the nerve, as well as the abuse that you went through. We know that you suffered some pretty significant pelvic trauma. So let's think for a moment about, but you know, healing is always happening, right? And when you're young and you're so resilient, you might not necessarily feel that injury until you're older. And Dr. Weiss talks about that in this book. And this book is free on Kindle Unlimited. So if you have a Kindle, you can sign up for the Unlimited program, free for the first month. You might find it interesting to read a little bit. You know, I always say whenever anybody gets this, as you read it, I want you to think about your unique anatomy. I want you to think about what was happening back then, what was the bicycle seat potentially doing, et cetera, et cetera. So Anissa asked on Facebook, she goes, does IC cause a persistent genital arousal disorder? And the answer is no. Pudendal nerve pelvic floor dysfunction does. If you have tight muscles, they're going to compromise nerves, et cetera, et cetera. Okay, so anyway, we know in your case, you sustained muscle trauma from the bike, from being a victim. And we also know, based upon what you said earlier, that you cannot pee normally, that you have to push, you strain to pee. Okay, so that is muscle. That is absolutely muscle. If you cannot, you must, as I said before, urination is about relaxation. You sit on the toilet, a muscle relaxes, a sphincter opens, you pee. If you cannot do that, that means your muscle is tight. And so let me ask you this. Did you say you had children?
Yes, I have two.
Okay. Has sex always been painful, or is sex comfortable?
Yeah.
Always
It's
been
been
painful.
painful.
What about, did you absolutely dread going to the OBGYN when you were younger because you knew the speculum would hurt?
Oh, yeah. The ER, I would go to the ER because I would be in so much pain.
Right.
And they would go to do a pelvic, and I would tell them how bad it would hurt. And they would just say that it's all in my head.
Right. Okay. So you have vaginismus. Vaginismus, vaginismus, tight pelvic floor muscles. It's just it's a fancy way of saying tight pelvic floor muscles. And you've had tight pelvic floor muscles since you were a teenager. And a consistent sign of that is you hated going to the OBGYN because you knew it would hurt, and that sex is painful, and you cannot start your urine stream right away.
Correct.
So I cannot imagine you not having significant pelvic floor dysfunction. I think you probably do, but I'm not a doctor. I can't give you medical advice. My job is to educate you and kick you in the butt, get you to go talk to somebody and explore this avenue. It's very important that you understand that we don't think of IC as an incurable bladder disease anymore. Your symptoms are not suggestive of that. You're having more muscle symptoms, and it's never my place to criticize a doctor in any way. I never want to do that. My job is to bring you and your doctor together. Okay, that is my job. I'm astonished and horrified that you have not had a pelvic floor assessment, because that's IC 101. And the AUA guidelines say, and these were released in 2011, that the pelvic floor is to be studied at the first appointment.
Well, I remember them making me hold my urine, and they did an exam. The nurse practitioner did an exam.
But that's not it. That's not the exam.
The doctor has never done anything physical other than hydrodistension. And I had Botox. The Botox didn't help.
So did you ever have a hydrodistension? Did anybody?
I have it every 3 months.
Oh, that's right. I'm sorry, but they don't see anything. They don't see anything in your bladder.
She says that my bladder looks angry. Those are the words that she used. It looks angry.
Yeah, but
she doesn't show me pictures, nothing like that.
But when you distend the bladder, it looks angry. The worst thing you can do to a hollow organ is stretch it. It's going to turn red. I think that. Do you have a good OBGYN?
No.
Crap.
The urogyno is who I see.
And your urogyno never did a pelvic floor examination?
Nope.
I'm just horrified. I'm horrified on your behalf that hasn't happened.
I pretty much only see her like right after surgery. She doesn't see me in the office. I call, say, hey, okay, it's time. Let's schedule the surgery. I go in and have it done. I go home. She does not do follow-up in the office or anything like that.
Yeah, hon, you need a second opinion. In my opinion, it is time for a second opinion. This isn't, it's not making sense to me. Hold on. Again, we have Robert Evans in North Carolina. Voted again. Every year he's voted the top IC doctor. I mean, like 10-1. No doctor ever comes close to his votes. His patient, 99.9% of his patients adore him, and he's a master diagnostician. Are you close at all to?
It would take a couple of hours, but I would be willing to go. I would.
Then do it. Just Google Robert Evans, Wake Forest. Listen, you've been dealing with this for a long time. It is time for you to have a proper pelvic floor examination, and let's get this credibility tested here. If I lived within 2 hours of the top doctor in the world, even if I had to lay in the back seat and have somebody drive me, I'd get my tushy down there right away. I think that you would really benefit from that. Okay.
Thank you.
You know, and again, the American Urology Association says very clearly, if a patient is not responding to therapy, don't keep doing it. Take a step back and let's reconsider the diagnosis. You having a hydrodistension every 3 months, I don't know of a single published protocol which supports that. The hydrodistension is done normally if the diagnosis is in doubt. And there are a few rare older patients who might benefit from it, but girl, you're young.
Yeah. So after I get it done, I have severe pain for a couple of days. And then I'm able to hold more urine, not go quite as often.
Yeah.
But it wears off in like a month and a half.
I know, but it's not doing anything constructive for your bladder. It's not doing anything to help you urinate. It's not addressing the fact that you can't pee normally. It's not addressing the fact that you strain to empty your bladder. It's not addressing the fact that sex is painful. It's not addressing the fact that all of these examinations are super painful. And, you know, remember, I've been a support group leader for 27 years. So you're kind of the perfect example of a patient who would have been put on Elmeron and sent on their way, where you'd have been on Elmeron. You know, you would have been on Elmeron for 20 years, never getting better because nobody ever looked at your pelvic floor, right?
Yep.
Yeah.
The only thing is my doctor did, when I asked her what else could we do, I sent an email and I was like, hold up, I didn't see her before surgery or after surgery.
Yeah.
Why is my doctor avoiding me? Why doesn't she actually talk to me?
Yeah.
And she ended up calling me personally.
Okay.
And she said that really the only thing left is InterStem.
Well,
that's what she said.
And InterStem, according to the AUA guidelines, would be completely inappropriate at this point in time. You know, that's step 4. You haven't even done step 2 correctly. So let's at least I mean, and that's not me. That's the American Urology Association saying that. You know, I mean, we don't want to. Go ahead.
That's why I've been doing a lot of research, and that's how I came across you.
Yeah.
She doesn't tell me anything.
Well, I think it's time for a second opinion here, and you're really close to one of the best in the world. Why not? It'll take you maybe 6 weeks to 2 months to get in there, but call and make an appointment. You can get through the next couple of months. And listen, on InterStem, you know, I ran the support group here in Northern California when InterStem was developed. I've been a support group leader with InterStem from day one before it was even FDA approved. It is not easy. It is not easy. It is as I said, and I can show you this at another time. No, actually, you know what? Let's just do it right now. So hold on a sec. Let me go to, I want you to see this. So on our website, by the way, I have the original IC support forum, and I've got 4 discussion areas about neuromodulation, trying it or considering it, undergoing trials, successes, and failures. And you really need to look at all 4 of those. But a big part of this, and let me just share my screen here. All right. All right. Y'all can y'all see me right there?
Yes, ma'am.
All right. So let me go back to my browser. What did I do? Here it is. All right. So all you have to do is Google MAUDE database. That's like the old TV show MAUDE, M-A-U-D-E database. First link is the MAUDE database with the FDA. And this is where doctors are required by law to report problems with medical devices. This is where patients can file reports too. So what we're going to do is we're going to go down to brand name and we're going to put in InterStem. You know what? Let's just do, we'll just search the month of July. So let's see what we find in the MAUDE database. Oh, look at all these adverse event reports filed on July 31st. Here we go to page 2, July 30th. Look at this. Like 10 a day.
Wow.
July 29th, July 28th. So let's just pick one randomly. Migration or expulsion of the device Information was received from a patient with an implanted neurostimulator for a pelvic floor therapy and incontinence. They reported that they fell off their bike and landed on their stimulator. They turned the stimulation off and still had pain when they bent, sneezed, and moved. They felt fine when they were not moving. They could feel the stimulator had moved and felt a wire was close to the surface of the skin. They called their doctor, who suggested following up with the manufacturer in a week or two. The patient thought the issue should be addressed by the doctor and asked if there was anything the rep could do. And you can see here that there's no follow-up. That's the problem with this database, is they don't give you follow-up. Let's go to another one randomly. Oh, here you go. Information was received from a patient with an implanted stimulator. It was reported that the wound had not healed up completely. The patient first noticed the wound was not healed and felt heat from the site and was back in May of this year. The patient contacted their doctor and received antibiotics. The patient said that the site had healed more except for one corner. However, last week they noticed it was draining something green. They said they took a culture and placed the patient on a different antibiotic. The patient seems to be healing. They're diabetic. Okay, I'm going to leave it to you to do your due diligence and look through this. You will find hundreds and hundreds and hundreds of reports. The biggest issue with InterStim is post-op surgical infections, deep tissue MRSA infections. So drug-resistant MRSA infections, but the device can move. The device can turn off. It can turn on. I had one patient call every time she had a bowel movement, she was getting shocked. Certainly not normal. Her doctor told her that was normal. I told her that was not normal. She called the company and they confirmed that that was not normal. The biggest issue, so you gotta understand that this device requires constant maintenance. You have to understand that it may require multiple surgeries. And most importantly, the worst thing that happened to a patient was to a nurse who had 3, and she was actually in your state, I think. I think she was in Virginia. There were 3 urologists in her town. They all told her, you have to have InterStim. She called me. She said, I feel like I'm being forced into it. I said, well, I don't know what to tell you, but it sounds like it. She needed treatment. She agreed to do it, but she was a nurse. She was smart in the sense that the first thing she did is she talked to the doctor's billing office and said, is this covered by my insurance? And the doctor said yes. I mean, the doctor's billing rep said yes. Then she called the hospital she worked at as a nurse where they were going to do it. And she talked to their billing office and said, is this covered by my insurance? And they said, yes. Then, out of an abundance of caution, she called the health insurance company itself and talked to them and said, is this covered by my insurance? Do I require written pre-authorization? And they said, it's covered, no problem, you're fine. She has it done. A week later, she had a threat to garnish her wages due to a $50,000, $60,000, $70,000, $80,000 bill for the surgery because they lied to her. It was not covered. And she called me hysterically angry, not hysterical. She was just so angry. And the mistake that she made is she didn't get it in writing. And so I would absolutely, if you're thinking about going down this pathway, get everything in writing, get the authorization in writing. Ask your doctor, will you cover me if I lose my health insurance? Because a lot of doctors dump patients as soon as they lose their health insurance, and that device needs attention. Because if a device starts to malfunction, you've got to go get it fixed. And so there are some doctors, they just drop them. Hey guys, I talk to them. They call me. They're desperate. And this really supports the case for trying a less invasive neuromodulation first, because it could potentially help to relax muscles. That's where urgent PC comes in, the ankle stimulation, which is called post-tibial nerve stimulation. The cool thing about that, they were both invented at UC San Francisco. I'm north of San Francisco. I ran the support group for them. And the guy who invented the ankle stim was so horrified by what was happening with the InterStim group, because back then they didn't use anesthesia for their trials. No. The patient trauma was off the charts. At least they use anesthesia now. So that you had this other doctor, Dr. Marshall Stoller, watching the InterStim team going, guys, you can hit the same nerve. It's just at the ankle. And so he went to prove it. And so it's specifically the SP6 ankle point. It's about three finger widths above the ankle bone and about a finger width below. And I have a video on it. It has all the same FDA approvals as InterStim. And yet if you look at the MOD database, the last time I looked, there were only one or two adverse events, and they were both for tingling in the feet afterwards, compared to thousands. And it might be covered by your insurance. It is covered by Medicare, and it is a fraction of the cost. Whereas the device can cost $50,000. 10 of the ankle stims might cost a couple $1,000s. And when I was taught to do it, back before they had a device and a company was making money off of appointments, they just gave us a TENS unit and needles, and they showed us how to put it in. So at a minimum, I would go to urgentpc.com, and there's a list of doctors there, and you can just say to the doc, hey, listen, man, I've read about InterStim. I've looked at the FDA database. I am not prepared to do something at this point in time that has so many serious adverse events. I would like to try the easy one first. And if your doctor doesn't know about urgent PC, you can educate him about urgent PC, because a lot of doctors who do, like Ken Peters, who's a top InterStim surgeon in the nation, is also doing the urgent PC research. So I would look at the less aggressive form. I wouldn't be worried about adverse events so much. What I do say to patients is, it's never supposed to hurt. It's a acupuncture needle. The needle doesn't hurt at all when they put it in. I mean, it might be a tiny prick, no big deal. They attach a little electrical thing to it with a little cord, and then you've got a little device in your hand, and you just slowly turn it up. And you'll know it's working because you'll see your big toe bend down. Your big toe will bend down, and your other toes will kind of splay out, or your other toes will just splay out. And that's how we know we're right on the right nerve. Okay, I know you're cringing. No, it's fine. It's fine. Then you just pull it. You just reduce it a little bit because it shouldn't hurt. And you do it 20 minutes once a week for 10 weeks. And I will tell you, I walked into that in severe agonizing pain. By my third appointment, I had my first 2 hours without pain. By my seventh appointment, I had my first day without pain. And this was after a solid year of level 7-8 pain. And so I believe that urgent PC is what broke me out of that pain cycle. So
I definitely talk to her about it.
Yeah. It's InterStim's kind of a moneymaker. And so, oh, look at that. I just scratched myself. I don't know. Let's see. Why don't you see what Dr. Evans has to say, okay? Okay, I'll be right back. I'm bleeding now.
Thank you.
Typical.
Hi.
All righty. Girl, looks like we get to, I don't know, we haven't done Lisa yet. Lisa came in, but that's okay.
Lisa.
Let's see if she's there, okay? Hold on.
Okay.
Lisa, are you there? I cannot mute her. It doesn't look like she has a microphone attached. Lisa D, are you there? All right, Donna. Girl, how are you?
Hey, what you doing, girlfriend? I just had to come on and see you. You know what I mean?
I know. It's always good to see you. So Donna has been.
I had some bubble. I've got bubble. Well, I've got vulvodynia now. But it's so funny because there was a time when you said if things are working, go back and revisit the whole diagnosis, right?
Right.
So what I did was I went to pretend like I don't have IC, because they all knew I had IC, right? Pretend like I don't have IC and let me talk to you, right? I just said, put it out of your mind. Who cares? We all know it's there, whatever. Let's move on. Let's just do this, okay? And they all said, okay. And I told them, I said, my foot, it is numb. I fell. Remember, I was telling you how I fell on the step when I was exercising, it's still numb. And I was saying, and as we were talking, I said, and also what's really interesting is that, and you just addressed this in the meeting, when I have to urinate, I can feel it in my feet. I'm like, I can feel it. I know. My feet tell me when I have to urinate. It's like, I can't, my physical therapist was like, well, Donna, can you hold it a little longer? I said, no, because it's painful, because I know that I have to go. And then once I go, I'm pretty much okay, right? And it used to be a time also, Jill, and I'm skipping around a little bit, but it used to be a time when I was first diagnosed with IC. If I ate something, my bladder would tell me. Mm-hmm. I could feel it in my bladder. I could feel things going on. Well, I do bladder renew, cysto renew. Mm-hmm. And I was Elmeron at one time. Yeah. Okay. And I got allergies, so I was also doing Claritin D. Yeah. And at one time I was on vitamins, a lot of vitamins, but I got off of those because I wasn't sure if that was contributing to the IC as well. So I kind of like went free of everything. Right. So since I was doing all of these things, so it came to a point where it seemed as though my bladder was getting better. Yeah. But I was still feeling this numbness in my foot. And I was still telling them, I was trying to tell them, hey, guys, I don't know what it is. What pain goes from your foot to your, I have flat feet. I said, the pain goes from your foot to your bladder, your bladder to your foot. I said, I don't know. You guys tell me. I said, but I'm telling you right now. I said, and I'm with the IC Network and Jill, and I'm telling you, because I take them everything. I said, I'm telling you, I have to pee. I feel it in my feet. Something's going on there. You know what I'm saying? And they were like, So my neurologist, he said, okay, Donna, this is what we're going to do. We're going to do a nerve conduction. I said, hey, look. I said, wait a minute. You're going to do nerve conduction? I just got finished telling you. And I'm telling, and I'm peeing every 2 hours, that the frequency is still there, right? Yeah. And I said, I don't know if I really want to do this with the nerve conduction. I said, because it might send me into a flare. He said, come on, Donna, you can do it. You can do it. So I did it. And of course I did flare a little bit, but I still did it because, Jill, I wanted to know. Yeah. I wanted them to do everything they could do to figure out what the heck was going on, right? So he does I have an MRI, he does the pelvic floor thing, and he does everything he's supposed to. I have the nerve conduction done. He's like, Donna, everything is fine. I said, okay, that's cool. But somebody needs to tell me why it is that when I have to pee, I feel it in my feet, right? And he's like, I don't know. He's like, I don't, he's like, oh my gosh. So
it's just proximity.
It's crazy, right? It is. It's like, and he didn't do, and what was so nice about it was the fact that they didn't discount anything. Right. They may not have known. They were willing to go with me down the road. Okay. Yeah. My GYN, my neurologist. And then I even went back to my podiatrist and I said, forget I have IC, forget about all that. My feet, I'm having, the same issues. Tell me what to do. And then she wanted me to go on this diet. And I know what you're going to say. I do. But it's pH neutral diet, right? You eat everything. I know. She said, because sometimes when you're acidic, when your body is acidic, it can affect your nerves. So if we can get your body less acidic and get it back to the normal pH, which is 7, if we can get you, I know, but listen to what I know what you're going to, I know, baby, I know, I'm telling you. She said, if we can get you back to that 7 instead of too far to the left, which is acidic, or
acidic to the left,
or too far to the right. If we can get you in the middle, then that might help with your nerve pain, right? Because I figured, hey, if I'm having frequency, and I kept remembering what you were saying was that when your nerves are turned on, you have your C fiber, and then you have your what's it called?
Alpha
A.
Alpha afferent.
Thank you, alpha, exactly. And then you've got your C fiber. If your nerves have been turned on for so long, especially the C fiber ones, it's hard to turn them off. It takes a long time. It takes a long time to turn those nerves off. So I told her, and she agreed. She was like, okay. She said, but would you like to go with me down that road? And I said, okay, fine. No one's ever done it before. Let's do it. And so I got on this. I did what she asked me to do, but my bladder could only take so much of it because it was a lot of lemons and limes and. I know. I'm being honest. I'm telling you. I know what you're gonna say, but I'm telling you, it was a lot of lemons and limes. It was like a lot of greens, your kales, your parsley. You had your for inflammation or your nerves, and then you had another one for if you were hormonally imbalanced, right? And she wanted me to go through all these. And so, I told her, I said, I can only do so much of it because of she was like, okay, no problem. So I left that alone, and then COVID came. Yeah. So I never really got back to her. So I kind of fell away from the diet issue. And I know you talk about the pH water because she wanted me to do the pH water, the whole 9 yards, right? That's all she wanted me to drink. I know, baby, I'm with you. Trust me when I tell you. So she wanted me to do all that. And I thought, open your mind, Donna, you've never been asked to do this before. So at least someone else is thinking outside the box. They're trying to do something different. So I thought, okay, fine. But I only went so far with it. And of course, I'm right here every Sunday. I'm right here with you. So I'm like, Donna, don't.
See the flaw with that line of thought is that pH is controlled in your bloodstream through very, very specific mechanisms. Mm-hmm. It is controlled to, it's finely controlled. Mm-hmm. And like you would be dead if it changed 1 point. You can't change the pH of your bloodstream. Only your body can. What you can do is you can change the pH of your urine. You can change the pH of your stomach contents. But, there was an old supplement, kind of like Preleaf, but it wasn't Preleaf, it's another one that got laughed out of the IC community because they kept saying the reason you have IC is because you have an acid body. And they were just saying, this is why you buy our product, you have an acid body. And that has just been kind of a marketing term for people that are selling stuff. To me, the flaw in that line of thinking is that it's not addressing the quality and health of your skin. Girl, you and I are older now. We both have estrogen atrophy.
Yes.
And the ability, and so what it shows is a shocking dismissal of the role of hormones in and aging and what that does to our bladder, as well as the mucosal layer itself, And so for anybody putting you or I on a regime of limes and lemons when we clearly have dry skin is sort of
I know.
It shows course in GSM. Because what we should be doing is improving the quality and health of the skin, and so how do we do that? And that's where, this is where kind of the supplement industry, especially kind of the predatory supplement industry, is kind of known for making claims like that, saying you're sick because you're acidic. You're sick because of this. You're sick because of that. We can fix it. We will make you less acidic. When there's no scientific grounding in that fact. Those are the fly-by-night companies, that have been come and gone, like that supplement company that tried to do it to the IC world. And what was hysterical, I got to tell you what was hysterical, is they tried to make a low-acid coffee. And you know what they did? Is they coated coffee beans with sodium hydroxide.
Stop it.
They did.
Get out of here. I'm getting off the air. Sorry, guys. YouTube, I see you guys. I gotta go. No.
I know they did. And,
no
and
way.
So they they tried to sell me this low acid coffee, and we know coffee acidity is based upon the how it's roasted, you know, where it's grown, and how you perk it or whatever. And so it was like throwing an elephant, a chemical elephant, at this little tiny fragile tissue. And they said, would you sell it? I'm like, no, no way I'm selling that for you. That's ridiculous that you would asking me to ingest sodium hydroxide into my body.
Girl, Trump stopped it, but
I know. Well, yeah, there you go. So
I know. So I just couldn't help it.
Yeah. So they got, and as much as I chastised them, I actually sent them down to Bev Lauman, who was running the Orange County IC group, and they went in and talked to her group, and she just nailed their butt, and they walked out with their tail between their leg, and they've never returned. So
Jill, how many people are on the bandwagon with that? Because I've met people here in Virginia I'm in Stafford, and who I go down to Costco, whatever, and I talk, you know how you get into a conversation, start talking, and you'll be surprised that there are people who do that they believe in that theory of, if I lower my pH,
it's going to make all your diseases go away.
Then I can make my body healthier. That's going to improve whatever it is that's going on with my body.
So the appropriate context in that is to reevaluate the food that we're eating, the manufactured food that we're eating, that is so high in acid, like soda. Yeah, if they said, hey, can you just stop the soda? Can we drink some water? Like, okay, there you go. That's healthy advice. But what you're saying is keep drinking the soda and drink the juice of a lemon, take the acid reducer, take this all, it's just, I'm so uncomfortable with that.
No, and I know you are. And I thought to myself, well, I better let her know that this is what what I went through. And I think that I tried to keep my wits about me while I was doing it, because I wanted to give it a try. Sometimes, in my mind, I think, you know what, you never gave it a try it. See what happens. See what it does. Maybe you're a miracle. Maybe you're somebody who can deal with it. So therefore, it may work for you. And then you can be a testimonial that it did work, right? So anyway, make a long story short, it was like I could only do so much of that in the story. So
well, I mean, so the whole foot thing is just a proximity of a nerve. And I've talked to many people who have exactly the same thing. So not worried about that. The quality and health of our skin is something that we've got to pay attention to.
And of course, the urinary genital, how you say, the
genital urinary syndrome with menopause.
There you go. And I've got the patch, I've got the ring, and it's doing so much better for me. And I think I've got my appointments in the middle of September with the neurologist, the gyno, and then I've got my family practice doctor also. And so when I go into her, I haven't seen her for a long time. And when I go back into her, I'm going to say, hey, Reed, listen, pretend like I don't have IC. I want you to do a full physical on me. I want you to do blood work. I want you to make sure that I'm not vitamin deficient. Because I haven't seen her in a long time. I want you to start from scratch to see what it is now. Now that you have my records and now that you see what I've gone through, now I want you to just act like you have no idea what's going on. And I want to know from scratch what could be happening, whether I'm B12, whether I need magnesium, whatever, vitamin D3, whatever it is. I want to know, hey mom, how you doing? She's right behind you.
Mom, people
She's
can see
in,
you.
Jill. Hi mom.
You're live.
Hi mama.
That's Donna.
Yeah, yes, it's me.
Donna.
It's me.
She's my
it's
friend
Jill's
Donna.
sister. Hi, baby.
This is Donna, my friend Donna.
Oh. It's your long lost daughter that you didn't know you had.
That's true. That's true. We are very much IC sisters. So we're still doing our meeting. So is there something you need?
I'll get it. I want your book, a Kegel book.
It's not in here.
I put it in here.
You put it in here?
You need to help mom. You need to help mom, Jill.
No, Mom, I went through everything. That book is not in here. For sure, 100%.
I put it there.
I know, but I cleaned through all of these books about a month ago when I cleaned off all these shelves. Your book might have been recycled. If it wasn't something I was using, I might have just gotten rid of it. Any extras would have been right here. Yeah, no, Mom, it's not here. No. I cleaned, oh, you slid it right there. Okay. You keep that, okay?
Okay.
You don't have to bring it back in here.
Thank you.
Okay, now come on.
Thank you.
Yeah, you're welcome, baby. I love you. Mwah, mwah.
Okay. You're supposed to use your walker. Hey, listen. I gotta tell
What are you gonna do, Jill? You gotta do what you gotta do. You know what I'm saying?
No. Let me tell you. I love my mother. She puts things in the weirdest places, and she will put a little tiny thing in a big giant box, and then she will put that box into another box, and that box into another box, and it's like, where is it, Mom? I put in what box? Where's the box? And then she stacks them all. My whole life is breaking down boxes in this house.
Hey, only she can find it. You do know that, right?
Oh,
when she came in there, she knew where it was because you didn't find it. She did.
I know. She's a finder. I would never have known because I'm in here. That's funny. All right. Well, listen.
So anyway, to as a long story short, and I know it is, it's just that things are moving along, and I like that, and I'm glad that the doctors. That's why it's so important, Jill, when you do go back and you talk about the basics, or when you talk about IC and you say, hey, revisit it. If things aren't going the way you think they are, revisit the diagnosis, because I think that helps the other doctors. If they're good doctors and they care enough to challenge themselves, that they will go with you. They'll go on that journey with you. They'll say, you know what, let's do that. Let's just start from the very beginning. Let's go where we haven't gone before. Right. And I believe when you say those things, and I've challenged my doctors, I think that's a good thing. So I want the IC, I want the Facebook and the YouTube. I know we're going to go back to YouTube because that's where I am. I think that that's so important when Jill says revisit those things, because challenge your doctors, do that, because I think that opens up a whole new world when you do revisit the diagnosis.
But it requires the patient to educate themselves enough so that they can have a discussion about it. Have you considered this? Have you considered that?
Jill.
Have we ruled out this? Have we ruled out that? We cannot be passive patients. We have to be active patients and pretty assertive patients too. So
amen, Jill.
All right.
Amen.
Hey,
amen.
So I got to shut down the Zoom meeting, but
and
Donna,
for IC Awareness Month, guys, is coming up in September, and I know Jill has the fires going on in California. Hey guys, we can just do what you can for IC Awareness Month in your neighborhoods. I know it's coronavirus time. I know that it is. Whether we have to get together, whether we have to schedule something ourselves and just kind of do a mock meeting, whatever we need to do to support ourselves in IC Awareness Month, we're going to do it.
So the
website, we will. We're going to make Jill proud of us, whatever we can do, okay? And I know Jill's going to be there supporting us as well. So I just wanted to say that. Thank you, Jill.
You are welcome. The ICAwareness.org website is completely updated now. There is a working functional press release. It is on Elmoron. And I'm asking patients to educate doctors about Elmoron. Probably going to do 1 or 2 more, but I've done everything I can. The poster contest is active. I already have our first entry. The meme contest, you guys, if you make posters, $100 gift certificate, Amazon different gift certificate for the winner, $50 gift certificate for second place, $25 gift certificate for third place. Yeah. The winner of the poster contest usually becomes the poster for the following year. That is true with this year. You can download posters, you can, but you know, like as I wrote in my editorial for our magazine, I rewrote it yesterday. There's a hell of a lot going on right now, and IC awareness is not as important right now. We have other things that we also need to focus on. So anyway, well, listen, let me shut down Zoom. Lisa, we never got to you. Feel free to reach out to me. You can get my phone number.
Eric, did you see Eric right here? He came in.
Yeah, we talked to Eric. We did him first.
Oh, did you? Okay, cool.
Eric took us on a car ride too.
Oh, that's right. He sure did. Hey, Eric. Yeah, he's walking in his kitchen. Okay.
Okay.
Hey, Eric.
Okay. See you later, Zoom.
Bye-bye. I'm going right back to you.
All righty then. Zoom is shut down. Hello, Facebook. Hello, YouTube. I'm back. Thank you for your patience and listening. I hope that you find it interesting and helpful to hear other patient stories. And what that does is that absolutely shows you the diversity in this patient population. Lisa Smith, I had a similar experience with InterStim. Even the doctor wouldn't monitor after he implanted it. Sales rep dumped me right after the post-surge shock. Never did anything for me. Both the wire and battery moved. I finally got frustrated and wanted it out. New doctor I've been seeing for years for other issues said he really believes in Axonics' new device. At this point, I'll try almost anything. So 2.5 weeks ago, I had my InterStim placed with Axonics. I'm already so much happier. The rep is so nice. He'll be my post-op appointment. I haven't had a urinary accident since it was put in. Awesome, Lisa. That's good to hear. Axonics is a new. Is Axonics the ankle stem, or is that still the pudendal stem or sacral stem? I don't remember. I'm getting a little tired now. It's been, you know. And Lisa, you should, Lisa is a registered dietitian too. I bet you would enjoy talking with Julie Beyer. In fact, Lisa, let me make you an invitation right now. And please, please, please remind me, send me an email. We have got to finish updating our diet list. And I would love to bring you in on that team if you would like to be part of that team. Because Bev has retired, and so it's really Julie and I, and the ICA kind of split off and did something else. We all worked together for a while, and then we kind of split off, and it was kind of weird. But anyway, I really want to update the diet list, and I'd love to bring you in on that if you'd like to do that. But you have to email me and remind me about that. Send me an email and say, I'm the dietitian. I'd like to be part of the diet update, because our apps are woefully out of date, and they probably don't even work with current operating systems right now. Jana says, urgent PC works, not well, not painful. Yeah, it worked for me. I mean, there you go. Lisa says, I was first diagnosed with vulvodynia, then IC. I was too. Well, let's see, I was diagnosed first with urethral syndrome. Then I was diagnosed with vulvodynia. Then I was diagnosed with polycystic ovarian syndrome. Then I was diagnosed with irritable bowel. And then years later, I was diagnosed with IC. Lisa, hey, Lisa, too, if you want to share your story on having the Axonics device, if you want to write it up, I'd be happy to put it in our magazine and on our website. You can share your information on being a dietitian if you want to help people. That would be fine too. We are a robust, dynamic community. Yeah, I'd love for you to do an article which compared your experience with InterStim with Axonics. That would be so cool. And it's not that I'm not a fan. It's that I work more with people with problems, so I'm more aware of the problems. Listen, neuromodulation is insanely beneficial for people who are incontinent. If you were fecally incontinent or had total bladder incontinence, InterStim is life-changing. But you just have to understand the risks versus the benefits. It's something, it's not like you do it once and you don't ever do it again. It takes time to get through this stuff. Patty says, I've had pelvic floor issues more after my vaginal hysterectomy and bladder repair. Have done pelvic floor therapy. I have high-pitched pelvic floor. I had bad back surgery in 2000. Girl, let me tell you, my pelvic floor was toast after my hysterectomy. It's still not quite, you know, back. It's way better than it was, but you can tell. I mean, I have a lot of adhesions where my cervix was, so they're quite painful. Patsy says, my first 15 years of IC pain, I tried everything, heard it about to stop the pain, went to every doctor, literally spent $100,000 on things that didn't work, went to Northwestern, where a guy recommended InterStim. Yeah, at the time, you were a competitive athlete, ran, swam. The only reason I was talked into it is because he told me a top soccer player in Europe had one and he was back playing in his league. I figured that if that person could run, fall, and collide with others, then I could go back to competition. So the first I had a temporary InterStim. The control is on the outside, and I had to change the dials to supposedly dial out the pain. I was supposed to be able to phone the Medtronic person and talk to her. She only took 2 calls and told me, you're a big girl, you're figured out yourself. Wow. I almost said the F word. Despite that, I went ahead and had the actual InterStim put in. Doctor makes a back pocket in your rear. Wires run from the base of your spine to this thing. I've made 4 trips. I must have made 4 trips a week to downtown Chicago to have adjustments. Every time I went, the nurse would ask me if I had left my screen door shut on my rear or if I jiggled it. They didn't tell me there's a very dangerous battery implanted that if compromised can explode inside of you and kill you. I don't know of one ever exploding, hon. Just telling you right now. I was given a magnet the size of a horseshoe to use on this thing. If I went wonky, I would walk through security entrances and set them off. I could not go through regular security at airports. They had to use wands. And I had to carry proof that I actually had this thing in my body. It never did work properly. And after a few months, my urologist told me the wires had migrated, which means they came apart. I was so crazy by then. And had gone through all this for nothing. I had this doctor remove it. Good. He actually apologized to me, but got frustrated and asked if I wanted him to remove my bladder. That's when I walked out. Holy girl, your story. That's when I walked out. I was a couch potato several years after trying pelvic therapy and other things, including hypnotism. So you had Hunner's lesions. And you had a cystoscopy with ketamine and steroid injections, and those healed your lesions. Girl. See, that's why subtyping is so important. Because your IC subtype 1, Hunner's lesions, you should have been immediately given Hunner's lesion therapy. You should not have gone through all the other stuff you went through. Girl, I am so happy for you. This is wonderful. She says, I wanted to tell you, in my opinion, InterStim is dangerous and useless. Maybe it will work for you, maybe not. I wish you the best. There are so many quacks out there promoting goofy pills and things. It's true. Hunner's lesions require Hunner's lesion specific therapy. Guys, if you haven't watched my video on the 5 subtypes of IC, it's on my Facebook page. It's on YouTube. You can go to our website. It's important that you understand the diversity of IC. We no longer think of IC as an incurable bladder disease. We think of it as a pelvic pain syndrome. Why? Because there are other structures in the bladder that are often involved. And so I use a subtyping system that has 5 core variants: Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, and central sensitization. This was a system created by Dr. Christopher Payne, who ran the IC research program at Stanford University for 20 plus years. And using his system and using any other current subtyping system, especially U-point, input, the subtyping system done in Europe, you are immediately put on Hunner's lesion therapy when you got Hunner's lesions. It is what it is. And so that you went through InterStim and they never treated your Hunner's lesions is ridiculous. Absolutely ridiculous. And Patsy, I'm so sorry you went through that. That is stunning. I would actually really love to tell your story. You know what? Hold on a sec. I'm just going to copy and paste it. I'm going to copy and paste your story, and then I might reach out to you. Hold on a sec. Hold your horses, baby. Hold on, I gotta write this down. That is such an important story to share. So let's see. AKAMAIL. All right. All right, guys. Well, listen, we've been doing this for about 4 hours. I'm still happy to take questions. So I can go for another 20 minutes or so. If you have questions, if not, we can shut it down. Y'all tell me what you want. How is life? I don't know if you heard that the Social Security actuary issued a statement this week that said that if Donald Trump manages to shut down the tax program that funds Social Security, disability insurance will defund out next year. And 2 years after that, we will lose our retirement benefits completely. The fund will be eliminated. So if you need your Social Security, if you need your Medicare, if you need your retirement or disability, hey man, this is not the time to be silent. You gotta act and let them know this is not okay. Social Security is not an entitlement program. We pay into it. It is insurance we pay for out of our own pocket. And it is disgraceful that they are thinking that this is okay. There's a great quote from Dwight Eisenhower who talked about that any party who proposed shutting down Social Security, Dwight D. Eisenhower said would end instantly. And he said, there's only a small group of people who believe that that's okay. And those are multimillionaires, you know. So please speak out. I was planning to retire with my retirement benefits, and now they are under jeopardy because of an idiot. Michael says, I've had IC for 20 years. Flare-ups used to last 2 to 3 days or up to 1 week. This one is on and off for 6 months, back on amitriptyline, arthritis, strength Tylenol, Azo, even Percocet on the strictest diet, but you still have pain, frequency, and urgency. Bladder installation is too painful for the urethra. Anyone else experience this type of relapse? So Michael, I talked about, I don't think you've been here throughout the whole meeting. I know you probably haven't. We had a brand new research study about men who had testicular pain and scrotal pain. And you know what they found? Is that 70% of them had a hip problem, that it was a mechanical injury. There was a problem with the hip that was messing with their muscles, which was causing the pain. And so remember, with subtyping, we're definitely looking beyond the bladder at other structures which can also trigger the symptoms that we associate with the bladder. I'm going to tell you, Michael, that 90% of the guys that I work with, we can go back and find a pelvic injury. Easy. And so I would really want to know, number one, what the health of your pelvic floor muscles are. And go back in time. Your symptoms started 20 years ago. Do you associate any events with the onset of your symptoms? Do you associate any falls, car accidents? Were you an athlete? Anything at all like that? Can you remember anything that happened before your symptoms began? Rhonda said, who's the winners? I think I heard you say, no, the winners of the Doctors of the Year were Robert Evans, and then for Doctor of the Year, Dr. Macaron was nominated. It's just he didn't have as many nominations. And then the Nurse of the Year is Elizabeth Kustouris, who is in New Jersey. at Virtua Sexual Wellness and Pelvic Health. And then the physical therapist of the year is in Texas, Rebecca Rauch at the Women's Hospital of Texas. So those are the winners for last year's Doctor of the Year. It was a couple months late because of COVID. So, but anyway, got those done because we are now accepting nominations again. If you go over to icawareness.org, remember September is IC Awareness. Whoops, see my little slide there. September is IC Awareness Month. We ask everybody to nominate doctors and nurses and physical therapists who are treating them well, because they need the positive affirmations too. They need to know that we appreciate their effort. So they all get very, very nice wall awards from us. Lisa says, I hate chairs. Yeah, I am on a ball, and it's running out. But the chair that I sit in the most is this chair. And I don't know if you can see this. You can see that the base of the chair, I really love this chair because it moves as I move, and it's got really good support here. I mean, so I think this is one of the favorite chairs I've ever had. And I actually saw it advertised on Facebook, but then I went and I did a lot more research on it because I spent thousands of dollars on chairs. And then the other chair that I have, whoops, is this chair. Uh-oh. Yeah, see, you know, what do I say? It's not an IC support group meeting if I don't drop things, right? Stay. This is pretty cool because when you sit on it, you know, I mean, it really flexes up and down and it moves, right? And then, of course, I have a sit-stand desk. Drop my vulva. But it's just, I totally messed up my SI joint earlier this week working on our magazine. So anyway, that's real life, right? Amber, you're very welcome. Amber says, thank you so much for talking to me. I'm going to go speak to my family doctor and get the PT going. So check pelvicguru.com or check our website too. And we have a doctor list on our website. You can search also. All right, my friends, last call for questions. Last call for questions. Okay, but see, Michael says, I just signed on. Thank you for the information about the possible hip injury. Don't recall any, but we'll talk to the doctor. Michael, if you pop me an email at icnetwork@mac.com, I can try to find that research study for you that you can give to your doctor. You have, but see, dude, you say something here that's really important. You have good pelvic floor muscle control, but it hurts. It hurts. Your muscles hurt. And Michael, really, seriously, you got to get this book. Listen, it's free on Kindle Unlimited. It's free, right? But you can get it from us in print. It's worth $7 cheaper than Amazon. Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. This is a master class in pelvic anatomy. And let me, you know what? Hold on a second. Let me just go through. It's filled with story. Let me go to the section on let's see, like as an example, one of the areas that really hurts men and women is the perineum. The perineum is that little bit of skin between the rectum and the base of your testicles, or for a woman, between the rectum and the vagina. And when I was going through vulvodynia, let me tell you, that perineum felt like somebody was rubbing sandpaper on it. It was so painful. Like, oh my God, terrible pain. Like Norco, Vicodin level pain. It hurt so bad. And I always wondered why. What is it about that area? And in this book, he explains exactly why. That immediately above the perineum is it's called the perineal body, and it's an attachment point for four muscles. Four muscles attach immediately above the perineum, and that's why the perineum hurts so bad. So anyway, he's got a thing in here about men. More commonly, I hear men complain perineal pain than women. This I attribute to the relatively larger, more clearly defined area between the scrotum and the rectum. And here, hold on a sec. Let me see. And he says chronic perineal pain is usually the result of myofascial trigger points in the anatomical perineum, the urogenital diaphragm, the pelvic floor, and or perhaps even pudendal neuralgia. I think that you would find his discussion. So here we go. Let's see. Let me just read this. Let me just read this one story. This is David's story. David was an impressive shape of a man, for a man of 68, with regular training regimen that would make many men 20 years younger cringe. Nonetheless, he was out of his league when he sprinted up a very long, steep flight of historic stairs in San Francisco one morning and immediately developed perineal and scrotal pain. He phoned his general practitioner about the pain, who called in a prescription for Cipro without an appointment or examination, based upon the assumption that he had a routine prostate infection. When David reported the side effect of severe diarrhea, his doctor switched him to doxycycline and referred him to a urologist. This specialist found signs of inflammation with white blood cells in the prostate fluid and told him to stay on the doxycycline. David followed this advice for a full month, yet the pain persisted, and finally he came to see me. When taking David history, I learned that the pain increased with sitting and decreased with lying down. He described sitting in his office chair as miserable and confessed that he was having trouble concentrating on his work. He also revealed that he was having difficulty achieving an orgasm and recalled experiencing similar scrotal pain in the 1980s when he was an avid bike rider. My internal examination revealed exquisitely sensitive pudendal nerves along the Alcock's Canal between the sacrospinous and sacrotuberous ligaments and in the nerve's perineal branches. There was also sensitivity of the perineal skin with skin rolling and with pinprick tests, providing further evidence of a pudendal nerve involvement. However, his genitalia was normal. I treated David that day with a bilateral pudendal nerve blocks in all areas of tenderness. A follow-up exam 3 months later revealed no pudendal nerve sensitivity at all, and all of his symptoms had resolved completely with that single procedure. In fact, David reported that he'd been sitting there for 3 hours at a stretch with no problems. The bottom line, it is my strong opinion, based on 45 years of practicing as a practicing urologist, 16 of which have been devoted exclusively to treating chronic pelvic pain patients, the chronic perineal pain in men is seldom the result of a prostate infection. In fact, I have yet to see such a case. If practitioners understood this, they could spare their patients unnecessary suffering, unnecessary expense, and unnecessary exposure, in many cases long-term exposure to antibiotics such as Cipro that can have serious side effects. Urologists receive training in organ diseases such as prostate problems, but they have no training in pelvic muscle and nerve pathology. Given that the prostate is in the region of the perineum, their immediate and generally unfounded assumption is that pain in the perineum must be a prostate infection. Indeed, their training is so limited that even when there is no sign of infection or inflammation, pain in the perineum is still frequently termed prostatodynia, which simply means pain. that pain in the prostate. That unnecessary term could be eliminated if routine training included recognition of muscle and nerve-related pain. Phenomenal book. It's free on Kindle Unlimited. Come on, guys. You got to get your knowledge level up there. You got to learn about these structures so that you can have a good discussion with your doctor about this. Thank you guys for the prayers of the flyers. The book is Breaking Through Chronic Pelvic Pain. Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. It's on the front page of our store on our website. All right, guys, I'm going to give you your homework. Now listen, you know, we are not passive patients. We do not sit at home in our bedrooms in a dark room and cry to ourselves. We are strong. We are bold. We are determined. We are going to ask and ask and ask and ask until we get some answers as to why we are suffering to the degree that we are. Am I right? You better believe I am right. Okay. So the way you do that, though, is with knowledge. So for 15 minutes a day, like seriously, you can read a half a chapter a day. If you're like me, you're going to read the whole book in 2 days, twice, which I did. I've actually read it 3 times now. Anissa says, what's my take on mesh? I think mesh is one of the most tragic episodes to happen in medical devices. There was I was at the first American Urology Urology Association convention where they brought back the tests of mesh that had been removed from people, and it was covered with infection. Mesh, it turns out, harbors bacterial infection terribly, biofilms. And what's interesting is what starts out as white mesh becomes black tangled mesh as it interacts with the human body. But no, I think it was either Frontline, I think it was Frontline on PBS, or it might have been 60 Minutes, who did the most amazing documentary on mesh. And it was disgraceful what had happened, that they were buying, and I forget the name of the company, they're obviously being sued now, or the suits might be done. They were buying polypropylene plastic. It was never meant to be used in the human body for this mesh surgery. And finally, the company that they were buying it from said, guys, this isn't meant for human use, and stopped selling it to them. This was never meant for human use internally inside a body. This plastic, polypropylene. So what the company did is it went to China. It went to China and it looked for a supplier in China. And this documentary had a picture of this dingy little manufacturer that they bought like 25 years of polypropylene from. And then, Anissa, and then the company forged the labels. They had to say that it wasn't polypropylene. They changed the label to get it into the United States. There's this whole fraud with the labeling going on. And they went through this with the documentary, and the company couldn't explain. I mean, it was just disgraceful. And then when they got it to the United States, they then had to perform those basic tests. And the stuff that they got from China did not perform to the same standard that the stuff that came from America, but yet now they had a 25 years worth of this polypropylene. And they still didn't disclose the name of the source of it's very weird. They couldn't trace the source, all that sort of stuff. So Anissa says it was Boston Scientific and you were in the lawsuit. Yeah, I mean, absolutely. When you look at the shenanigans that this corporation did, it's nothing short of evil. Absolute evil. An example of a company that put profit ahead of safety and proper testing. And it also showed really, really clearly the absolute inappropriate influence that these corporations have with the FDA. We rely on the FDA to judge the safety of stuff. And yet it is very clear that FDA staff is in the pocket of, some FDA staff have been in the pocket of some of these companies, which has led to early approvals and inappropriate approvals. Or, you know, as an example, when InterStim came out, I asked for the 5-year follow-up report from the FDA. The company, Medtronic, was required to provide a 5-year follow-up report that would reveal all of the side effects that they had monitored and studied over the first 5 years that it was available. And I asked the FDA, first of all, I asked the FDA for it, and they go, really? They didn't even know. It's like, guys, it's right here in the approval. And so they then sent a letter to Medtronic and asked for it. And so I give them a year. I contacted the FDA again and said, yeah, I'd like to get a copy of that FDA follow-up report. And they lied to me the first time. They said they didn't have it. And then they said they got it, but it wasn't done correctly, and they had to send it back to Medtronic. And then 6 months, gave them another 6 months. It's like, do you have it? And they said, yes, but we've decided that this is proprietary information and we cannot give it to you. And my answer back to them was, well, then how can patients make an informed decision if the company is not releasing their follow-up data on side effects? And I've tried. I got Senator Feinstein involved. I mean, you know, man, I tried to get that data. They locked it down with a fine-tooth comb. Michael, the author is Dr. Jerome Weiss. Dr. Jerome Weiss was a extremely well-known pelvic pain doctor in San Francisco. He's now retired. It took him 15 years to write this book. And this is really a love letter to his pelvic pain patients. And it shows on every single page. Stunningly good book. So I was hoping that we could get, you know, I mean, the thing with the other thing with InterStim is the fatalities. I mean, the last time I went through the data, probably 4 or 5 years ago, I found 20 fatalities, patients who had died. And reports were filed with the MOD database showing that patients died, and they thought that the death had something to do or could have had something to do with the InterStim device. And there was one case of a patient whose heart rate matched the pulsing of the device, you know, that the device was influencing heart rate. And I really thought that, you know, we would be able to get 60 Minutes or somebody to look at the FDA data and why people were dying. I did go to a urology, National Institutes of Health conference, and I did challenge a couple doctors and said, can you explain why patients have died? And they didn't take that question well from me. I'm still friends with those doctors. I'm good friends with those doctors, but, you know, let's just say I nailed them. And their answer was, we never know why somebody dies. Well, I really think that there needs to be an investigation as to why patients have died with InterStim. And I did a big article on that on our website and on our magazine like 5 or 6 years ago. Debbie says, had to be away a while. I don't know if you answered my question about Elmeron. I had fulguration 10 days ago. Urologist wants me to take Elmeron for 6 to 12 months. She knows about the retina damage danger, but thinks I'd be okay. Even if I did agree to take it, I can't afford it. Do you have a suggestion as to what I could do? So, Debbie, if you look at the FDA, the new FDA warning on Elmeron, they specifically state that the 3-year mark appears to be the big risk, that if you've taken it 3 years or longer, that's when the big risk of eye disease appears to happen. However, they made it very clear that patients who have used it less than 3 years also have shown changes in their vision. And in our patient survey, which have over 2,000 patients participating, we had a number of patients report that their symptoms began in their first year. And so between the FDA saying that and our data saying that, I would have, especially if you have a pre-existing eye history anyway, it doesn't sound like it would be a a viable thing to do. Instead, what you could do is you could do heparin and lidocaine bladder installations, which would give you a coating. You could do an Elmeron lidocaine installation, which would put 100% of the medication into your bladder, and it would not be distributed to any great degree systemically. So topical treatments are considered safer than oral treatment. Same with oral estrogen. Oral estrogen has been linked to breast cancer and stuff, but topical estrogen is considered much, much safer. But the $1,200 is overwhelming, and I don't know anybody who can really afford that. I certainly couldn't afford that. And so your next option is going to be a chondroitin-based supplement that might have a similar coating effect. And so something that will give you a little bit of a barrier. And so you're looking at Bladder Builder, Bladder Rest, Cysto Protect, Cysto Renew are the top 4 chondroitin-based supplements. I have an article. If you go to the front page of the IC Network now, there's a link to our Elmeron Eye Center to give people updates on what's happening with that. And then there's also a link to a new page that I built called Transitioning from Elmeron, where I go over as much as I can. I will tell you that I did ask our medical board and several doctors if they would commit in writing to some sort of transition plan, but I think that they're just too busy with COVID. So it is what it is. I did the best I could. And you just have to take that to your doctor and have a good discussion with your doctor about your options. All right. Let's go back to YouTube here. Let's see what else is going on here on YouTube. Thank you, Nina. Deb says, does the lack of estrogen affect the bowel? I don't know. That's a great question. I don't know. Let's look. So what I'm going to do is I'm going to say does menopause affect the bowel? Well, let's see. Oh, what a great question. I have to say my IBS has definitely calmed down a lot. When estrogen declines, cortisol levels rise. This can slow the digestive process, lengthening the amount of time it takes for food to break down. This can make your stool more difficult to pass. Too little progesterone can cause your colon to slow down. So it looks like it's going to be kind of slowing things down, weak pelvic floor muscles, things like that. But Google it, see what you can find. All right, guys, 15 minutes today. Let's get your knowledge level up. Listen, if you find these helpful, please become a member of the IC Network and get our magazine. I'm so surprised that there are still people who don't even know we have a magazine. We've been doing it for 13, 14 years now. And it's really where we do really in-depth articles. I don't put those articles on the IC Network website for 6 months to a year. There's a little bit of overlap, but like we're reviewing all the new things that were presented at AUA this year, as well as a couple of other things in the late summer issue, which will be done this week. For 15 minutes a day, I need you to do something that will give you some comfort, whatever that is, some spiritual comfort, something that will ease your soul. And that's certainly getting away from the internet, if at all possible. Go sit outside and watch some birds, or go to church, or whatever gives you comfort. For 15 minutes a day, I need you to do something for your bladder, your pelvic floor. Like, did you do your stretches? Are you following the diet? Make a good decision. 15 minutes a day. Do something for your body. I'm going to go I can't take a walk with my SI messed up like this. Dang it. I have to do something. Okay. And for 15 minutes a day, I need you to laugh. Because when you laugh, you modulate pain. When you're laughing, your brain interprets pain differently. And it will de-escalate pain. If you're crying in pain, your brain will intensify that pain because your brain thinks that it's more serious. But if your pain is accompanied by laughter, your brain will automatically kind of deprioritize that pain. And so laughter is so, 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 so important here. And it's hard to find right now. We're in for a hard couple of months. We're going to get through this together. Please, please register to vote. Your vote matters. We got to protect our health insurance. We've got to protect so much of what's going on. And I am hoping and praying that every single one of you will get out there and vote to protect our access to health care. Because right now that is under jeopardy, desperately. You and I have a pre-existing condition. There's a Supreme Court case right now, Texas versus California, that is arguing to abolish Obamacare and pre-existing condition coverage that is expected to be heard the week after the election. If Trump wins, we lose our pre-existing coverage, my friends. Do you know what that's going to do to our pocketbook? Do you know what that's going to do to our health insurance? It's terrible. So you need to vote. Please, please vote. All right. I didn't say for who. I think you know who I support. I'll talk to you later. Have a good one, my friends. I will be back. IC Awareness Month starts in 2 days. In 2 days, I'll be sending out a blast email to everybody about that, hopefully on that day. Okay? I'll see you later. Sign up for our newsletter on our Facebook page or on our website so you get all that good info. Thank you, Michael. Michael says you've been following the ICA for a long time, but you appreciate what we have. Well, hon, I started out with the ICA. I was a support group leader for them, but we split off in 1994 because we wanted to do different things. We wanted to be on the internet and deliver online support. They laughed at me when I said we want to do support on the internet. The IC network could have been theirs because it was my graduate project. I offered to give it to them for free. They gave me a lecture on knowing my place and how stupid of an idea it was. The rest is history. All right. Okay, guys. I'll see you later. Have a good one. All right, you two, my friends. I wish you the best. I wish you the best. Be well. Have a good week.